Meeting of the committee will come to order. We meet today for the purpose of marking up legislation, H.R. 3200, America's Affordable Health Care Choices. But before we begin opening statement, Mr. Barton had some questions that he and I would talk about related to schedule and other procedural matters. Mr. Barton?
First of all, Mr. Chairman, I wish to thank you and your staff for the cordiality that you have exhibited in this particular issue. I'm not real happy with the process, obviously, but I can say on the record that our discussions, both personally and through the staff, have been courteous and friendly, and for that I want to say publicly thank you. I'm not going to say nice things too many times, so is all right. Is it on now?
Yeah, repeat those earlier statements.
Well, I won't go through all the flowery language, but I do want to say, Mr. Chairman, that you and your staff have been friendly and cordial as we've gone through the process on this particular issue, and I want to say publicly thank you for that. I don't agree with the process, but I can say honestly that it's been friendly and an honest, cordial relationship. I do have some questions. My understanding today is that we will just do opening statements. Is that correct?
Yes, today we will do opening statements. Tomorrow we will begin at 10 a.m. to consider amendments to Division C with an expectation of finishing sometime around 3 p.m., which is, I understand it, the request of the Republican side. Then on Monday, we won't start, that's our plan for these 2 days.
Correct. And on Monday, my understanding is at minority's request that we have delayed the start of the markup until 4 p.m. so that members from the Midwest and the West Coast have a chance to, if not get to the markup immediately on time, reasonably close. I think some of our Californians and Oregonians plane gets in at 4:30. So my understanding is that Monday we'll start at 4 p.m. Is that correct?
Well, that's my understanding as well. But I would ask you if we could start the debate on the amendments earlier and allow the votes to be rolled, if any, are to be taken, so members can be here for the votes. Would you have a
well, we can. I mean, I will not support rolling votes in committee. That's problematic, and I don't want to start that once we start it, we can't stop it. But I have it, if we'll start at 4, our first amendment probably won't be ready to be voted on until 4:30 or 4:45. So I think we'll have the same effect.
Well, let me talk to you further about Monday.
Okay.
Monday's schedule.
Okay. Let's see. My understanding is that we should be prepared to work late in the evening each day that we are having markup next week. Is that also correct?
That's correct.
Okay. And it's my understanding that you intend to follow the tradition of this committee and the House in alternating recognition between majority and minority members who have witnesses, who have amendments at the desk. Is that correct?
I do, but I do want to mention that since we are having a requirement of 2 hours in advance for amendments to be available, if on one side or the other amendments are not available, we will go to whichever member has an amendment, even if it's somebody from the same side of the aisle.
Well, we will make sure, Mr. Chairman, that there is always a sufficient number of minority amendments at the desk. I don't think we will lack for amendments. So. Well,
if I decided to take 2 Republican members in sequence, would you object?
I would not object to that.
Okay, thank you.
Especially if one of them happened to be mine. But on the amendment process, we're going to begin the actual formal part of the markup tomorrow at 10 a.m., and you have this 2-hour requirement, but you also have the requirement of you're only going to take amendments between 9 a.m. and 9 p.m., so if we have a member of either side that wishes to offer an amendment tomorrow at 10, unless they turn it in tonight, they won't be able to have within the 2-hour window. For tomorrow, can we have a little bit of discretion?
Let's agree to this. The amendments can be presented this evening and certainly meet the 2-hour schedule for tomorrow, but we will also have 8 a.m. available, an 8 a.m. time frame for amendments to be presented.
Okay, and where would people come at 8 a.m. tomorrow morning? Just here into the committee room? Is that?
But that would be here, right? At the desk, right here, till 10 p.m. tonight, and as early as 8 a.m. tomorrow.
All right, thank you. You're going to consider Division C tomorrow. If members are not, if we don't get through all the Division C amendments tomorrow, would those still be in order Monday and Tuesday?
Amendments will be in order, even if we've passed by a section. We might ask that it be following the other sections consideration, so we don't go back and forth between different divisions in the bill, but no member will be denied an opportunity to offer an amendment, even if we've gone beyond that division.
And after Division C, you want to go to Division A, and then last but not least, Division B. Is that correct?
Yes, we will do that, and after we're done considering amendments to the current title, we'll consider amendments to this bill in the same manner, just as we did during the energy markup.
And last but not least, is there a provision in your manager's amendment in the nature of a substitute that covers the complexity of the amendment process that we just have discussed?
Is there amendment in the bill?
Yeah, that was a weird attempt at a joke.
That's a joke.
Yeah.
That's a joke.
It's pretty complicated. Under the rules of the House, Mr. Chairman, a member can just bring an amendment to the desk, and it is in order if it's germane. And that is the approach that I would prefer. But we're going to try to honor your request for the this amendment process.
I appreciate your doing that. I think it provides for a more orderly way for us to consider amendments, and the chair does have discretion in recognizing members, and I'll use that discretion to be sure that amendments are within the subject title that is under consideration, that has been presented at least 2 hours in advance. And if the amendments are ready, we will alternate between the Democrat and Republican.
And I guess the last, I do need to make sure everybody understands this. There is an amendment clerk czar somewhere that has a stamp that is going to stamp these amendments in. Is that not correct? Is that Sharon Davis? Is she the?
I don't know how it's going to be done. Is that a request?
Well, no, we were told that you had somebody. I was
I don't
trying
know.
to get that person on the record.
We do have staff. I don't know that they have a stamp, but they'll mark it down.
Okay. Well, we do need to, if we're going to have the 2-hour rule, there has to be somebody with a time stamp or a stopwatch that is ready to verify that. And I thought that I was told at the staff level you had that.
We'll be able to work that out.
That's not a joke. That's serious.
That's serious, and we'll have it amendments noted that, when they are presented.
Okay. That's all on the colloquy I have,
Mr. Barton, if I just might ask an additional question of the chairman, is it your intention, Mr. Waxman, to finish probably Wednesday night or roll into Thursday?
Well, I hope we can finish Wednesday night.
Okay, thank you.
We might roll into Thursday early morning, but I would hope we can finish Wednesday at a reasonable hour. We'll now begin opening statements, and I want to recognize myself first. Today we take up America's Affordable Health Care Choices Act of 2009. This legislation fulfills our commitment to deliver what the American people voted for last November: access to affordable, quality health insurance coverage for all Americans. The fundamental question before each of us is, will our constituents and our nation be better off in 10 years if we enact this bill, or will they be better off if we do nothing? Today we have the opportunity to make a difference in the lives of all of our constituents. From today, when a constituent comes to us and says, I can't get health insurance because I have MS or diabetes or any other health condition, we will have an answer. When people lose their jobs and can't afford health insurance, we will have an answer. And when a constituent tells us, they raised my premium set it so high I cannot afford it because of my health condition, we will have an answer. When a small business tells us the rates for their employees went up when one of them had a catastrophic illness, we'll have an answer. And when our providers tell us they are going under because so many people come in without insurance or have no place to get care except the emergency room, we will have an answer. When people ask, how can the greatest, richest country in the world have 46 million people without health insurance, we will have an answer. When people ask, why don't we prevent illness before it starts and manage chronic diseases so people don't end up in the hospital when it could have been avoided with better care, we will have an answer. When seniors say they can't pay for their drugs, when they go into the donut hole in their coverage, we will also have an answer. And we ask ourselves, have we started to make the significant changes in our healthcare system that will change the ever-increasing costs and inefficient way we deliver care? We will have an answer. That we have arrived at this pivotal moment is a tribute to Representative John Dingell, our chairman emeritus, who has made health reform a centerpiece of his long and distinguished legislative career. He has faithfully carried out the work of his father, who first introduced such legislation in 1943, 66 years ago. This effort now qualifies for Medicare. I also want to thank Chairman Frank Pallone and all of the members of the committee who have made contributions to the Dingell bill, and I'm honored to be a co-sponsor. H.R. 3200 is reform in its truest sense: expansion of access to health care, improvements in the quality of health care services, better public health outcomes, and control of costs for the benefit of all Americans. Today, America's health care system is no longer affordable. At $2.5 trillion per year, 16% of our gross domestic product, it costs too much for individuals, businesses, and the economy generally, and it delivers too little quality care. Our legislation delivers fundamental change. Health insurers will have to compete based on cost and quality, not on who is most effective at avoiding the risk. Our bill will unleash a series of delivery system reforms to reduce health care costs. If we do not enact this legislation, there will be no significant cost control reform, and health care costs will continue to rise. Our legislation will provide insurance coverage to 97% of Americans. If we do nothing, the number of uninsured will rise to 54 million. And our bill will dramatically increase access to preventive services. Under our legislation, Americans will always have access to affordable coverage wherever they go. Families can pick the insurance plan they want and their own doctors, and this legislation is fiscally responsible. We will assure that it will be deficit neutral and is fully paid for. Today is an historic moment for our committee, and I'm certain we will be worthy of the opportunity we have to make a decisive difference for the better in the lives and the health of the American people. I want to now recognize Mr. Barton for his opening statement.
Thank you, Mr. Chairman. I have a written statement that's rather lengthy, and I would ask unanimous consent to put it in the record.
Without objection, that'll be the order.
Thank you, Mr. Chairman. The thought that comes to my mind as I look at this bill is something that my mother told me many years ago when I was a young boy, writing out my Christmas wish list. She said, "Joe, be careful what you ask for." And I would say, Henry, be careful what you ask for. We have a bill before us with the best of intentions. We have members on this committee who have spent their entire career, and as you pointed out, the Dean of the House delegation, John Dingell, has introduced a comprehensive health care reform bill, I think, every year that he's been in the Congress, and before him, I think his father did the same thing. So it is not the intentions that we doubt, it is the actual work product. when you have a bill that the CBO, in a closed, members-only briefing, admits that they scored based on a verbal explanation of majority staff, that even with that cursory, primitive analysis, is $1 trillion, $1,000 billion cost increase over 10 years. In reality, the number is probably twice that, because the bill doesn't really begin to kick in until the year 2014. And the average cost from 2014 onward is over $160 billion per year. It doesn't include the macroeconomic effects, doesn't include an analysis of how price increases will affect the private insurance market. Just the pure additional coverage in the bill is going to cost $1 trillion over 10 years. Be careful what you ask for. Now, the additional bureaucracy that's created by this bill includes the Health Choices Administration, the Health Insurance Exchange, the Health Insurance Exchange Trust Fund, the Government Health Plan, the Bureau of Health Information, the Health Benefits Advisory Committee, the Center for Quality Improvement, the Comparative Effectiveness Research Commission, the Comparative Effectiveness Research Trust Fund, the Council for Comparative Effectiveness Research. Mr. Chairman, those are all brand new agencies, brand new bureaucracies. Each of them will have their own staff, their own budget, their own agenda, and they will interact with each other and with the market that currently exists in ways that we don't even know. We don't even know. We have a bill before us, Mr. Chairman, that is going to, just by common sense evaluation, devastate the private health insurance market. Now, you and the President have all said, if you like what you have, you will keep it. If you like what you have, you will keep it. But let me posture this. You have 10 employees in your business. You pay them an average of 40, the average income in this economy is $40,000. So let's say you have 10 employees, you pay them each $40,000. You have a private health insurance plan that you provide that costs you $7,000. That's an average. Some plans cost more, some plans cost less. As the employer, you compare that $7,000 to the $40,000 total compensation package, and it's over 8%. You can dump them into the exchange or the public plan and pocket the difference. You're not going to, if you like what you have, you're not going to get to keep it, because anybody, if you assume in the CBO score yesterday, the average subsidized cost was somewhere between $4,600 per person to $5,700 per person. If you take a number of $5,000 at 8%, that's $62,500. Anybody that makes less than $62,500 and whose insurance cost from the employer perspective is more than $5,000 is going to have a financial incentive to be dumped into the public plan. That's just economics. So when you say if you like what you have, you can keep it, that's only true if you make more than $62,500. So I'm not sure who put this together, but the plan that is in the bill before us is a direct attack on the private health insurance market and provider market in America today. A direct attack. So for the 83% of the American people who like what they have, this plan is a direct attack on you. There's no other way to put it. So, Mr. Chairman, suffice it to say, we will have a number of perfecting amendments. We will operate in good faith, but we are very, very leery of moving to this brave new world which within 5 years would so change the way health care is provided, paid for, and distributed in America that we won't know the health care system. And I don't think the American people, you know, another axiom is, if it ain't broke, don't fix it. Well, let's focus on what needs to be fixed. But let's don't revolutionize health care as we know it in America on a scheme that, to me, seems self-evidently guaranteed to fail. And with that, Mr. Chairman, I yield back.
Thank you, Mr. Barton. I now want to recognize the lead author of this legislation, the Chairman Emeritus of our committee and the champion of health care for many decades, Mr. Dingell.
Mr. Chairman, I thank you. I commend you for this hearing, and I thank you for your leadership in the matter. I also thank you for your kindness to me and for the gracious comments that you have made about me. Mr. Chairman, I have enjoyed many years as a member of this wonderful committee. The jurisdiction of this committee has allowed us to leave our mark on the history of this nation and on numerous and important pieces of legislation. Today, Mr. Chairman, we're about to begin consideration of what I strongly will believe will be one of the most consequential bills ever before this distinguished committee. Indeed, H.R. 3200, America's Affordable Health Choices Act of 2009, will forever change our economy and will make us a much stronger and healthier nation. Mr. Chairman, the task at hand is no easy undertaking, but we must act for the health of our nation, for the health of our nation's economy, and for the well-being of our people, and for the competitiveness of American business and industry. Every day, American families confront the crushing health care costs that are slowly taking away the security and stability that comes from having health insurance. Furthermore, the costs of our overall health care system are spiraling out of control and are on a path to bankrupt our families, our businesses, and our government. The moral case for health reform has been made since well before the first part of the 20th century, when my father was a member of Congress. Now the economic crisis generates a fierce sense of urgency to act, and the crisis worsens every day that we do not act. And I would point out that now the need for health care is exacerbated by the fact that our businesses are being made uncompetitive by this situation. So what follows? Premiums will continue to rise if we don't do something. And if we don't do something, Americans will continue to pay more for less generous health care coverage that will worsen every year. Businesses will continue to be less competitive. Fewer employers will offer health insurance to their workers. The number of Americans delaying coverage or going without coverage altogether will continue to increase. And health statistics of American people will get worse. If we do not take action, the cost of the average employer-sponsored health insurance plan for a family will reach $24,000 in 2016. This is an 84% increase over 2008 premium levels. Under this scenario, we estimate that at least half of American hospitals or households will have to spend more than 45% of their income to buy health insurance in 2016. Nearly 1 in 4 Americans under age 65, some 64.4 million people, will spend more than 10% of their family income on health care in 2009. The vast majority of these people, 82.6%, have health insurance. We have the opportunity and, frankly, the obligation to prevent then the next great economic catastrophe. Just yesterday, we learned in Michigan that the June unemployment rate for our state was 15.2%, the highest in the nation. This does not bode well for state and local governments, and it has left numerous citizens of Michigan wondering how they're going to make ends meet. Unfortunately, in most cases, each job loss means the loss of access to health care. H.R. 3200 offers uniquely American solutions to our health care crisis and addresses the insecurities related to health care felt by most Americans. The burden of the cost of health care has been placed on the economy and the competitive disadvantage experienced by our businesses. This legislation will assure stability for all citizens of Michigan and for all Americans. H.R. 3200 means stable coverage that cannot be taken away from life's ups and downs, stable costs that will not eat away at Americans' paychecks and will not put coverage out of reach, and stable quality so that individuals can get the needed treatments when they need them and from the doctor of their choice. I understand that many of my colleagues are not yet satisfied with all the provisions of the bill. This is why we have the markup process, so that we can work together to produce the best possible piece of legislation. While we may not agree on all of the particulars, I sincerely believe that all of us in this room, on both sides of the aisle, want to reform our health care system. I urge us then to listen and to work cooperatively together to get this bill ready to go to the floor by the end of the month. There are big problems facing our nation and its citizens. There are big problems facing this committee. Our solution must be just as big. We cannot shirk the heavy responsibilities we bear. We must meet this challenge. The American people deserve nothing less. Thank you, Mr. Chairman.
Thank you very much, Mr. Dingell. Mr. Blunt?
Thank you, Mr. Chairman. Mr. Chairman, we can all agree that it's both desirable and necessary to make some changes in our health care system. We should build on the parts that work and fix the parts that are broken. Many people are satisfied with the coverage they have now, which is why the President and others consistently say, if you like what you have, you can keep it. But I have some grave concerns with this bill and look forward to discussing them with the committee. I, along with many of our colleagues on both sides of the aisle, have ideas that we believe would greatly improve our current system. We wish they were included in this bill. Most importantly, I don't believe that the government-run health care plan is the best plan for the people we represent. Our goal here should be to create a system that's more affordable, with access for everyone regardless of any pre-existing condition, and has more choices, not fewer choices. A government option would be like an elephant in a room full of mice. The fast mice get out of the room quickly. The slow mice eventually get crushed by the elephant, and the only thing left in the room is the elephant. As a Republican, I wish I could find a better analogy than that, but I think it describes what I believe would happen if we have this government competitor. This plan would simply lead us down a path to a single-payer system where there's only one choice. Americans would have to face the same issues that British and Canadian patients currently deal with, such as long waiting times to see doctors or receive routine procedures. If this panel thinks a plan that raises taxes, I believe kills jobs and limits access is good enough for the people that we represent, then it ought to be good enough for us. And Mr. Chairman, I plan to introduce an amendment to this legislation which would require all federal elected officials, including each of us and the President and the Vice President, to enroll in whatever government plan this body creates. I look forward to this debate and appreciate the opportunity for the discussion we're about to have, and thank you, Mr. Chairman.
Thank you, Mr. Blunt. The Chair is now honored to recognize the very distinguished Chairman of the Health Subcommittee, the gentleman from New Jersey, Mr. Pallone.
Thank you, Chairman Waxman. Reformers, Democrats, and Republicans alike have all attempted to fix our nation's healthcare system for decades. Presidents Roosevelt, Truman, Johnson, Nixon, Carter, and Clinton all tried to enact comprehensive reform, and none fully succeeded. In some instances, incremental reforms were born out of the ashes of failed attempts and provided coverage to the most vulnerable segments of our population, the elderly, the young, the disabled, and the poor. Now, President Obama is carrying the torch forward and has called on Congress to enact comprehensive health reform this year. The bill before us answers that call. It will significantly improve our health care system as well as the lives of millions of Americans. And I want to stress that there are more things we should agree on about this bill than disagree on. First, we all agree that we want our friends, families, and constituents to have access to an affordable and quality health coverage plan the same way we as members of Congress do. We all want the security of knowing that getting sick doesn't mean going broke. We all want a health care system that results in health care coverage that is portable, so that we can pursue our ambitions without worry. We all know that we have to share in the responsibility of fixing our health care system. Patients, providers, employers, government, insurers, and industry all have a role to play. And we all want to wring the inefficiencies and abuse from our current system so that we can reduce costs and get the most out of the health care system. And finally, we all want to rein in the soaring health care costs that have had a crushing effect on American families, businesses, and government budgets, and this plan will accomplish that. America's Affordable Health Choices Act of 2009 will meet these needs, and the bill envisions a world where every American family has access to affordable and quality health coverage. Those who are currently unable to access coverage will now be able to do so through an improved system that guarantees access, quality, and affordability. People who already have health coverage that they're happy with will be able to keep their coverage and their choice of doctors. But health reform isn't just about improving coverage and access. It's also about improving the public health. Too many people are suffering from preventable illnesses and conditions such as cardiovascular disease, respiratory disease, and obesity-related illnesses. And accordingly, we must change the way we think about medical treatment by focusing on preventative care as well as the quality of care being provided. And America's Affordable Health Choices Act also will do that. But what doesn't this bill do? And I stress, this legislation does not create a single-payer government-run health care system or put us on a path to one. This bill will not put a government bureaucrat between you and your doctor. This bill does nothing to ration care. On the contrary, the bill will expand access to medical care for the millions of Americans who are currently only able to access it through an emergency room or a safety net provider. Yet this bill will have its detractors, many of whom will use misleading criticisms. But I say we must not be fooled. We must keep our eyes on the prize because this is the moment that many of us have been waiting for, and more important, this is the moment that generations after generations of Americans have been waiting for. I want to thank you, Mr. Chairman, for the time and for all the tireless work you have done to bring us to this point today. I watch you, and you seem almost exhausted and going from room to room and meeting to meeting and, just worrying about everybody and spending time with everybody. In addition, I want to thank Chairman Emeritus Dingell, who's not only helped lead our efforts this year, but who's been a leader on this issue for his entire career. And I yield back the balance of my time.
Thank you, Mr. Pallone. The Chair would now like to recognize a very valuable member of our committee who serves as the ranking member of the Health Subcommittee, the gentleman from Georgia, Mr. Deal.
Thank you, Mr. Chairman. Throughout history, most major societal changes have come about in one of two ways. They've either evolved over a period of time and are incremental in nature, or they've been the result of sudden, often cataclysmic actions that happen rapidly. In both cases, however, there must be an underlying reason for the change. Today, this committee begins the process of implementing one of the most monumental changes in American society to take place in our lifetime. It is the transfer of the responsibility for providing health care from the individual citizen and his employer in the framework of a free enterprise system to the federal government, where legislators and bureaucrats are expected to decide how health care will be delivered to our citizens. Unlike the incremental approaches of the past, this is a legislative tsunami that will sweep away the long-standing advances that have made our health care system the envy of the world and leave in its wake a system of government-dictated health care that at best has a lackluster record of success in those countries that have tried it. But every change, whether incremental or revolutionary in nature, must logically have a reason in order to justify the change. In this case, one of the stated reasons for change is the desire to provide health insurance coverage for those who are currently uninsured. According to the testimony from CBO on yesterday, even after the plan is fully implemented, there will still be 16 to 17 million non-elderly that will remain uninsured. One of the other reasons for this reform is that it will make health care more accessible. Access depends on having doctors and hospitals that are willing to accept patients and the payments for services that they will provide. We know that these providers are already being compensated by Medicare at rates that are often below their actual cost of providing care. Yet this bill will establish a reimbursement schedule that is based on Medicare rates. If those rates are already making it difficult to find providers who will accept Medicare payments, what do we expect will happen when those rates are imposed on the general population? Well, so much for improving access. Another reason for this has been given is that the cost of health care needs to be reduced. Once again, based on CBO testimony, this bill will increase the federal deficit over the next 10 years by $1.042 trillion. That does not include the adverse effects on the economy as a whole, which CBO can't calculate, but they acknowledge will perhaps result in 750,000 job losses. These are just a few of the reasons that I oppose this legislation. No new doctors and nurses, lower payments to all health care providers, a restriction on choices for all Americans, a loss of hundreds of thousands of jobs, dramatic increases in the federal deficit, and lower quality of care. These are indeed changes, but I don't think they're the changes that Americans want. Thank you, Mr. Chairman.
Thank you, Mr. Deal. Mr. Markey?
Thank you, Mr. Chairman. Mr. Chairman, thank you for your leadership that you and Chairman Pallone and Chairman Emeritus Dingell have provided to move our committee to this point. Mr. Chairman, our healthcare system is broken. It is in urgent need of repair. Here's the problem. The United States ranks first in the world in healthcare spending, but 50th in life expectancy, behind Bosnia and Jordan. We are running a sick care system, not a health care system, in our country. Skyrocketing costs, which already consume about 16% of our gross domestic product, with no other country even a close second. These costs are still projected to double even more to 37% of our GDP by 2050, according to the CBO. This is unsustainable. Mr. Chairman, today you lead our committee to moving forward to reform our critically needed repairs on the broken system while confronting runaway health care costs that have plagued our system for years. While we are working to make the dramatic changes needed to strengthen the system for the future, there are those who are dusting off the same old tired arguments of the past in an effort to thwart real reform. Some of our Republican colleagues have reached back into their archives and trotted out a chart first used 15 years ago against the health care reform plan proposed by the Clinton administration. It is a golden oldie, and it shows that when it comes to making arguments against health care reform, that the GOP has a strong commitment to recycling. But the health care debate is about the crisis we're facing today and how we're going to fix it for the future. This is the crisis that we are facing today. It shows the eye-watering complexity and inefficiency of the healthcare system that we have today. Our current system, shown in this chart, is clearly in need of major reform. It is a convoluted mess that wastes money and leaves millions of Americans without insurance or inadequate insurance that fails to provide the coverage they need. While our health care system has been ailing for decades, today it is in the ICU. The health care system is broken, and we need to apply CPR in order to revive it. C, for coverage for those who do not have insurance. P, for prevention. Only 3 to 5% of the budget now gets spent on prevention, and 71% is spent on diseases caused because we don't engage in the prevention that would otherwise avoid those diseases, and R, for research in order to cure those diseases. CPR must be applied to this healthcare system. That's what this debate is all about. Let's not recycle the arguments of the past. Let's talk about what's going to happen here in the future in order to protect the people of this country. Thank you, Mr. Chairman.
Thank you, Mr. Markey. Mr. Hall?
Thank you, Mr. Chairman. I have multiple concerns with America's Affordable Health Choices Act of 2009, but I'll try to be brief and narrow my statement down to just a few points. I don't know many points because, like everyone in this room, or almost everyone in this room, I've not read the 1,000 or so pages, but I have some idea, and I have some things that I'm concerned with, and I'm concerned that I'm afraid this bill could end up limiting access and decreasing quality, especially for our children. And when I say especially for children, I say first especially for poor children, because they're hit first and they're hit hardest. But children are also hit. They're next on my table of those that I'm more concerned about. Medicaid insures more than 1 in 3 children of Texas, making it the single largest children's health insurance program and the single largest payer for children's hospitals. Children's hospitals are major providers of children insured by Medicaid. In FY 2007, children insured by Medicaid accounted for 50% of inpatient care, 45% of all outpatient visits, and 58% of all emergency room visits at freestanding children's hospitals. Medicaid is often the building block for health care efforts, and we must ensure that this program remains strong to ensure that coverage translates into access. The public plan proposes to pay at least Medicare rates to ensure access. However, Medicaid pays on an average of 20 to 30% less than Medicare. When examining Medicaid and Medicare reimbursement rates on average children's hospitals, Medicaid payments are only approximately 80% of what Medicare would pay for similar services. For physicians, Medicaid only pays 72% of what Medicare would pay for the same service. All Medicaid providers should be reimbursed at levels equal to Medicare. I have just one last minute. I want to say that the Democratic bill, and I'll close with a statement from the U.S. Chamber of Commerce, which represents thousands of U.S. employers that provide tens of millions of jobs, and they say in one brief paragraph, the Democrats' bill fails to pass our simple litmus test. This legislation will not address the nation's health cost explosion, will steeply take taxes in an already precarious economic situation, will fail to lead to more affordable, accessible, quality health coverage, and will lead us toward government-run health care. In short, it will make a bad situation worse at great cost to the nation in jobs, taxes, and freedom. Mr. Chairman, we should not be raising taxes on our small businesses, especially at a time when so many hardworking Americans are struggling. After all of the bailouts, with cap and trade looming over our heads, and now this massive health bill in front of us, I am, for the first time in my history, worried about the future of this country. That's signed by the chairman of the U.S. Chamber of Commerce. I thank you, and I yield back whatever time I have.
Gentleman's time has expired. The chair recognizes the gentleman from Virginia, Mr. Boucher.
Well, thank you very much, Mr. Chairman. More than 47 million Americans lack health insurance today, and millions more are underinsured, meaning that they simply can't afford to pay for the medical care they receive. Due to the cost shifting that comes from treating the uninsured in emergency rooms, the costs imposed on private health insurance, on Medicare, and on Medicaid are enormous and are growing each year as the numbers of the uninsured Americans increases. And society as a whole is bearing these costs. So the status quo, as Mr. Markey said in his comments, is truly unsustainable. We need to assure affordable access to health care for all Americans. The cost of taking that step will be less than the cost of doing nothing. And so I support approval by this committee and by the House of a comprehensive health care reform. But, Mr. Chairman, the bill before us is away from where I think it needs to be before it will earn my support. I am skeptical of a government-operated health care plan. I prefer the creation of a health care cooperative that would be owned and operated by its members, which would compete with private for-profit health care plans. As a nonprofit, the cooperative would effectively serve as a check on the cost of health insurance generally. Use of a cooperative instead of a public plan also would enhance our prospects within this committee of obtaining bipartisan support for the reform effort. And I really think that on a matter of this scope and this importance to all Americans, that every reasonable effort should be made in order to enlist our Republican colleagues in both drafting and passing the bill. If there's going to be a public plan, its reimbursements for health care services should not be based on Medicare reimbursement rates. The hospitals in my district in rural Virginia and across most of rural America struggle financially. Medicare does not currently pay them what it costs for them to provide patient care. They depend on privately insured patients to remain financially viable. If a public plan using Medicare reimbursement rates undermines the private insurance market, as many think it would, these struggling rural hospitals could well close. And we've had hospitals close in my rural district for financial reasons in the past. Mr. Chairman, I have some other concerns, including the need to do more to raise Medicare reimbursement rates for services delivered by rural providers who suffer today a disparity in comparison with urban areas of the country. And I very much hope that over the coming week, the committee will address these concerns. And it is my hope that we'll be able to derive a consensus that will enable a broadly supported bill to move to the House and obtain a very broad vote within that body as well. Thank you, Mr. Chairman. I yield back.
Great. Gentleman's time has expired. The chair recognizes the gentleman from Michigan, Mr. Upton.
Well, thank you, Mr. Chairman. Mr. Chairman, I made a pledge, written pledge not too long ago that said that I would read the bill before I ever got close to voting for it. I'm glad I didn't start reading this 1,000-page bill, because this next 1,000-page bill came out only today. I'm from Michigan, and our unemployment, as Mr. Dingell said, is 15.2% statewide, up from 14.1%. And I would guess that there are a good number of areas of Michigan that are even considerably higher than 15%. We're not in the best of economic times, and employers and their families are really struggling. The Lewin Group says that 2 out of 3 Americans are going to lose their health care coverage under this bill. 2 out of 3. I thought folks were guaranteed to keep their coverage. But I wonder how many of those 2 out of 3 are going to lose their coverage because they also are going to lose their job. My bet is that they'd rather have their job than get unemployment compensation, and as we've seen in Michigan, get those benefits exhausted, which 18,000 Michigan families will do this month, and next month, and next month, and the next month. 100,000 Michiganders are going to lose their unemployment benefits this year. They're exhausted. NFIB tells us that as many as 1.6 million jobs could be lost under this bill. And I would note that Christina Romer, the chair of the President's Council of Economic Advisors, apparently reported that we'll lose 4.7 million jobs. NFIB says that 55% of those jobs are with employers who employ less than 100 workers. And that is before we get to cap and trade. Now, I've heard from some of my employers, Goodwill Industries, who rely on charitable contributions. I have one with 230 employees, many of them part-time. They're glad to have a job. They do a wonderful job. They tell me that it's going to cost them as much as $765,000 under this bill. Something tells me that they're not going to have 230 employees if this bill passes. I have a lot of farmers, fruit and vegetable folks, people that work really, really hard, don't have a lot of program crops. We rely a lot on migrant labor. And many of those growers file their taxes with S corporations. The surtax isn't going to be real popular on the farm. Canada and the Brits, they're cited quite a bit. And frankly, they have a luxury because they can have many of their patients needing care come to the States. The Wall Street Journal reports that Ontario sent more than 160 patients to New York and Michigan for emergency neurosurgery. Well, if this bill passes, where are we going to send our people? I don't know the answer to that. This 1,000-page bill needs to be vetted thoroughly before we can send it to the floor. I've been on this committee since 1991, and I do not remember a time that we skipped on a major bill like this in a previous year, the subcommittee of jurisdiction. We shouldn't have skipped that. We should have had the subcommittee vet this out. We should have had a better understanding to get this bill done. And I see that my time has expired. I yield back.
Thank you. Mr. Gordon.
Thank you, Mr. Chairman. I am committed to passing health care reform that lowers costs and improves quality for all Americans. I sit here today ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. I believe our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it is leading this country down a path to fiscal disaster. Our current system is riddled with inefficiencies and waste. Misaligned incentives increase cost and fail to reward high-quality care. However, we cannot fix these problems by simply pouring more money into a broken system. Here is what we must do. Find every penny of savings within our current public program and ensure we get more value for every health care dollar we spend. Be more aggressive in implementing innovative delivery reforms to bend the cost curve, and provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, Blue Dogs have put forth substantive policies in order to achieve common sense bipartisan health care reform. We look forward to working through the markup to incorporate many of them. We have a historic opportunity to transform our health care system into one that meets the needs of all Americans. We should not pass up this moment. I yield back my time.
Thank you very much, Mr. Gordon. Mr. Stearns?
Yeah. Thank you, Mr. Chairman. I ask unanimous consent my opening statement be part of the record.
Without objection, all opening statements will be made part of the record in their entirety.
As my colleague from Michigan indicated, this is a 1,000-page bill. At this point, I don't think many of us have even attempted to start to read this. Mr. Markey has shown a map of our current health care plan. We can show him a map which is a whole lot more complicated, and this is the bill before us today. It's just has more boxes than you can imagine, and so it's clear that this is a complicated system. Now, I think Mr. Boucher came up with a good idea, a bipartisan idea of a cooperative through the private sector. And I'd be very happy to work with him and others, particularly with the Blue Dog Democrats, as I know we will on this side, to give something that is incremental and moves the health care system that we now have to a better system. But you know, when you go through and listen to different members speak, perhaps none of us have the credibility as the CBO director, who's Douglas Elmendorf. He testified on the Senate. I thought I would share with you a couple of his comments. This is what he said when he was asked about this health care bill. He said, quote, "It'll weaken the economy." Then he goes on to say, "Instead of saving the federal government from fiscal catastrophe, the health care reforms in this bill being drafted by congressional Democrats would worsen an already bleak budget outlook, increasing deficit projections, and driving the nation more deeply into debt." Now, this is the director of CBO. He's a nonpartisan individual from the Congressional Budget Office, and he's given his objective, disinterested opinion. So I say to my colleagues on both sides of the aisle, if the CBO director, with his expertise, has indicated that not only will this bill be a catastrophe, will increase our debt and will not accomplish what it's supposed to do, I think we should take this 1,000-page plus bill and this other bill that's come back recently and junk both of them and come up with the idea that Rick Boucher talked about, a cooperative. Take the existing system, make it better, and help those people who are low income or those people that are without health insurance to give them tax refundable and perhaps make this health care system we have better rather than totally destroying it. Because that's what will happen once the government has a health care plan which is cheaper than the private sector. Everybody will move to this, and then what happens is everybody will be under this government health care plan. It'll be run by bureaucrats. So I don't think in the end, small businesses, individuals without insurance, all the people in America want to have this kind of bill, not to mention the middle-class Americans who will be taxed for this, either through their business or through their personal companies. This is bad bill for patients, this is a bad bill for doctors, and this is a bad bill for America.
Thank you, Mr. Stearns. Ms. Eshoo?
Thank you, Mr. Chairman, and to all those that have brought us to what I consider to be a historic moment. In fact, I think that we all feel the burden of history and the weight of history on our shoulders as we embark on this all-important effort. This began, as I think other members have recalled, with the dream and the advocacy of President Harry Truman. That was a long time ago, a very long time ago. And since then, presidents and Congresses have struggled to come to the moment where, as an industrialized nation, the only one in the world that does not have health care coverage for all of its citizens, arrive at the moment when we will design a plan to do so. Over the last decade, health care insurance premiums have increased 4 times faster than workers' wages, while the average employer-paid premium for family health insurance has doubled. This relentless rise in health care costs is a real drag on our economic recovery. This is devastating families, not only because of how insurance companies have treated them, but it is devastating them economically. It is devastating budgets in our states, and it's taking a national toll. Just this last May, 2 months ago, I think 2 months ago today actually, the Medicare Trust Fund issued its annual report. They said that it will go bust by 2017. That is not too far off from today. So we have many obligations to the children and the future generations that are to come, to the economic well-being of families and individuals, and to the fiscal well-being of our nation. And I think that's why today and this next week is really the moment that Harry Truman started to help to create and that we will realize. This is a long and complex bill, and the reason for it is because there is much that needs to be fixed. We believe, as Democrats, in choice. We believe in fiscal responsibility. We believe in accountability and transparency. And that's why I think a public option alongside private plans, where there will be true competition, is so important to the American people. So, Mr. Chairman, and to the Chairman Emeritus, to the Ranking Member, to the Subcommittee Chairman, to everyone who has worked on this, even before they came to the Congress with other responsibilities in public life, I wish us all Godspeed, because I think the country is not only prepared for this moment, but is praying that we will pass the most substantive legislation for our generation and generations to follow in our great country. It's an opportunity to make us stronger and better and reshape the 21st century when it comes to health care. Thank you.
Thank you, Ms. Eshoo. Mr. Whitfield?
Thank you, Mr. Chairman. And I think every member of this committee, as we enter this important markup, is striving to balance the need to reform the current health care system against the need also to prevent the economic collapse of the American economy. If you read almost any economist today, they point out very clearly how concerned they are about the current deficit of the U.S. government and how over the next few years with Social Security, Medicare, and Medicaid, we actually are going to be entering a very dangerous time for America. History shows also all too clearly that the cost of government programs are routinely underestimated. In 1965, when they were debating the beginning of the Medicare program, it was projected by many groups, including CBO, that the cost of the program in 1990 would be $12 billion. The actual cost in 1990 was $107 billion, and today it is over $450 billion. So at this present time in our economy, when we're striving with this huge deficit, it's imperative that this program be paid for. And we hear frequently that it will be paid for. But, for example, the Hospital Association has evidently committed to cuts of $155 billion over 10 years to help pay for this program. And I have a letter from the Kentucky Hospital Association, and they state very clearly that their share of that $155 billion will put the hospitals of Kentucky in such a precarious position financially that they question whether or not they can provide quality care that they need to do. And then, furthermore, I would say to you that small businesses still create most jobs in America today. And with the mandate that this legislation places on small businesses, particularly the pay or play mandate, in which they either have to provide a basic level of health care coverage covering 72% of the health care cost of their employee, or pay 8% tax to the government if the employee chooses to enter that plan, NFIB, other small business organizations say they are quite concerned about the impact that will have on small businesses as they help to try to get the America out of this current economic condition. So this is going to be a vitally important markup. We look forward to working with the other side of the aisle and everyone to come up with meaningful solutions to this very serious problem. Thank you.
Thank you, Mr. Whitfield. Mr. Rush?
Thank you, Mr. Chairman. I want to thank you, Chairman Pallone, Chairman Emeritus Dingell, and all the leadership of the committee for your outstanding endeavors in undertaking this challenging task to reform our country's health care system. Providing affordable health care service to the American people is one of our moral obligations. As the world's richest nation, it is incomprehensible as to why we still have 46 million uninsured citizens, with 8.6 million of those being children. Many communities are denied quality health care, and the current economic crisis is making it even more difficult for people to meet their basic health needs. We must not let them down. I have authored several provisions in this bill addressing disparities in medical treatments and outcomes, affordable medications under Medicaid 340B, and trauma center funding. And I will be offering several amendments that seek to strengthen the bill even further. Some of these amendments, among others, include provisions that will reduce healthcare personnel shortages, expand mental health services to specific needs of at-risk youth, protect children who fall between the cracks of the new reformed health care system, and ensure basic quality care for Americans who are incarcerated in our nation's jails and prisons. I will also offer an amendment that accelerates the availability of generic drugs in the marketplace. This will allow the federal government and consumers to purchase more affordable generic medications sooner than currently available. Further, I would like to continue to work with you, Mr. Chairman, during this process to address the thousands of patients who will inevitably be without coverage in a post-reform world. Mr. Chairman, the President promised we can. This committee can declare we have. We have solved the health care problem that the American people face. Thank you, and I yield back the balance of my time.
Thank you very much, Mr. Rush. Mr. Shimkus?
Thank you, Mr. Chairman. You know, the country knows that no one read the stimulus bill, and they're going to hold us accountable. Here's the tri-committee draft, which I was intending to read, but I knew that it would be superseded by the bill. And I was about ready to read the bill, but I knew that it would be by the manager's amendment. And we can go through this, Mark, but you know what? I know when we get to the floor that there'll be a manager's amendment that'll have 300 different pages that no one else will read. And that's the process that we have fallen into in this Congress. The brightest, the best, the smartest, most important committee in the House of Representatives, and we have resolved to bullying, intimidation, no transparency, and we ought to be ashamed of ourselves. The fundamental question before us is, will our constituents and our nation be better off in 10 years if we enact this bill, or will they be better off if we do nothing? Today we have the opportunity to make a difference in the lives of our constituents. From today, when a constituent comes to us and says, I've lost my private health insurance, we will have an answer. When people lose their jobs because we have passed an additional cost of doing business on business, and they say, why have I lost my job? We will have an answer. When a constituent tells us, I can't personally pay for health care anymore in this country, we will have an answer. When a small business tells us the rates for their employees went up, so they dumped all their employees into a public plan, we will have an answer. When our providers tell us that the public plan is no longer funding adequately the cost of care, we will have an answer. When people ask us, how can the greatest, richest country in the world ration health care and limit access to the most modern care and drugs, we will have an answer. When people ask us, why do we need a lottery system for a doctor's appointment, we will have an answer. When seniors say, why won't you tell us there's a drug that can save our life, we will have an answer. And when we ask ourselves, why would we accept a Canadian, a British, a New Zealand, Australian example of health care which rations care and limits choice, we will have an answer. I yield back my time.
Thank you, Mr. Shimkus. Mr. Stupak.
Thank you, Mr. Chairman. During my first campaign for Congress in 1992, I made a promise to my constituents that I would support health care reform and that I would not support the health insurance that's offered to members of Congress until they, all Americans, also had access to quality, affordable health care. I've kept that promise. I hear every day the heartaches of my constituents, the insured, the underinsured, and the uninsured. Those who the current health care system have left helpless, bankrupt, and disillusioned. I want to help all my constituents, but the proposal before us perpetrates a broken system. On this health care proposal, the CBO said yesterday that by 2016, 7 years from now, maybe 97 to 98% of Americans will have health care. CBO said the legislation does not address the inequities in the current system, and health care savings will come only through the public health insurance option by reducing payments to health care providers. A public option dictated by an unnamed health care czar, unchecked powers found in Section 123 and 141 of this legislation. CBO said the current legislation will cost us hundreds of thousands of jobs. So to the young mother from Hillman, Michigan, who just lost her job and was just diagnosed with multiple sclerosis, she will not begin to receive any help, if any, under this plan, and for her $2,500 per month injectable MS medication until maybe 2016. Or Mr. Powell, who's outraged by being charged $3,567 for a cortisone shot he received this past January. CBO says the inefficiencies, like Mr. Powell, will increase as savings is achieved by cutting reimbursements, in other words, by cost shifting going to patients on private pay. If the reimbursements continue to be cut, which healthcare providers will continue to see patients? In my rural northern Michigan district, we can't attract enough healthcare providers now, and one reason is because low reimbursement rates. Without a requirement that healthcare providers must take all patients in the public option plan, the public option plan is really hollow, and the underinsured will be perpetuated. Without real competition, like remove the insurance industry antitrust exemption, does a public plan ever offer lower health care costs? Without an end to balanced billing to the patient, cost shifting will go on. All Americans will pay more, and Mr. Powell will continue to pay more than $3,500 for a cortisone shot. So with the bill in its current form, there's no competition to provide health insurance. The bill does not address the inequities, the inefficiencies we find in Medicare and Medicaid, and cost shifting will continue. My constituents' concerns are not addressed. I'll listen carefully and support those amendments that provide for accessible, affordable, and efficient health care insurance. And of course, we haven't even addressed the sanctity of life issue yet. I appreciate the efforts of all those who've worked on this legislation, but I cannot support this bill in its current form. I yield back the balance of my time.
Gentleman yields back his time. Mr. Shadegg is next.
Thank you, Mr. Chairman. This is the most sweeping piece of legislation to come before this Congress in decades. It is coming before us under a deeply flawed, undemocratic, and inappropriate process. Rank and file members of the majority are not responsible for that flawed process, but it is still wrong. It is wrong that CBO has not had a chance to score the bill with a copy of the bill before them. It is wrong to attempt to force this Congress to pass this legislation in less than 2.5 weeks without allowing members of this Congress to come to terms with what the bill will do, and without allowing the American people whose lives will be affected to evaluate it. Let me state unequivocally, I passionately support health care reform. In my tenure of Congress, I have worked on health care more than anything else. I have fought to reform the system we have, which deeply needs to be fixed. I have fought for patients' rights. Let me also say that there are issues on which we agree and things we could pass on a bipartisan basis. Republicans agree we must cover every single American. Republicans agree we must cover those with pre-existing conditions and chronic illnesses and enable them to buy health care at a fair price equal to that bought by the healthy. Indeed, it was my bill, a Republican bill, that passed this Congress 3 years ago to create state high-risk pools and try to address the problem of those with pre-existing conditions. Day before yesterday, I introduced a bill, the Improving Health Care for All Americans Act. It provides care for every single American. Every American. It provides affordable coverage to every American with a pre-existing condition and every American with a chronic illness. I know about pre-existing conditions because my sister is a breast cancer survivor, and she was locked in her job for years. But we can reform health care without a massive government takeover. This bill is just that. 83% of Americans who have health insurance in America today are satisfied with their care. My bill would let every single one of them keep that care without change. The bill before us will force every policy in America to change. Every single plan in America will change. Contrary to the claims of so many, if you like what you have in America, be prepared to lose it. Don't take my word for it. Don't believe John Shadegg. Read Section 102 of the bill. It empowers the new Health Benefits Advisory Board and the commissioner, my colleague, Mr. Stupak, just referred to set new mandates for every health care policy plan in America. Every employer-sponsored plan, every plan in the individual market. Mr. Chairman, I implore you and all of those on both sides of the aisle, let's pass what we agree on. Let's cover every single American. Let's ensure that those with pre-existing conditions and chronic illnesses can get care at a reasonable price. But then, let's work together jointly to resolve our differences and control costs. That's the biggest issue here. We should not, I repeat, we should not force the 83% of Americans who like the health care plan they have to give that plan up. It's just wrong and it's unnecessary.
Gentleman's time has expired. Mr. Green.
Thank you, Mr. Chairman, and thank you for holding this hearing today. We begin work on a historic piece of legislation that will build on our current employer-based health insurance system to provide quality and affordable health care to all Americans. A national health care plan has been proposed since the early last century by President Theodore Roosevelt and proposed in the 1940s by President Harry Truman and the father of our chair emeritus, John Dingell. The time has come for the wealthiest nation in the world to provide access to health care for all its people. It creates a unique American system that's not a government-run, single-payer system. It builds on our employer-based free enterprise system to provide health care where the private sector cannot. H.R. 3200, America's Affordable Health Choices Act, creates a new health insurance exchange in which individuals can have access to affordable health insurance coverage from the public or a private plan. Low-income individuals will be eligible for subsidy to purchase health insurance through the exchange, and people who are happy with their current employer-based insurance will be able to keep their current coverage. I'm especially happy with the inclusion of the provision I've been working on for years with my fellow Texans and Florida members that will help cover uninsured children, 12 months continuous eligibility for children in states with standalone S-CHIP programs, which will also ensure states like Texas who often children are dropped off the CHIP rolls in times of hardship. These improvements to our health care system will help us address health issues for the approximately 47 million Americans who are currently uninsured. Every American should have access to an affordable health insurance plan of their choice. H.R. 3200 also makes changes in health delivery payment system. It places an emphasis on care coordination, and I'm specifically pleased with the inclusion of the community-based medical home model provision in the bill. We know there are coordinated care programs in operation in areas of our country, but we haven't captured the true cost savings measures of these programs on a nationwide level. The various medical home models in this bill will help us improve the quality of care for special needs populations, such as the elderly and those chronic conditions, and render cost savings. I'm pleased with the significant investment in primary and preventative care as well as other workforce provisions in the bill. H.R. 3200 to help address our primary care physician shortage by funding programs that allow for residency training in community settings, such as FQHC's, Federally Qualified Health Centers. I'm glad I want to thank Mr. Sarbanes for working with our office on this provision. Giving residents the opportunity to work in our communities allows them to understand that they can make a difference by serving in the primary care field, plus they can earn a living. I'm also happy we make significant investment in the field of preventative medicine. We have a shortage of public health care professionals, and these individuals serve on the front lines for pandemic flu preparedness and give the impending influenza season. We need more preventive medicine professionals in our country. I'm disappointed we were unable to eliminate the 24-month waiting period for disability for individuals under 65 because of the enormous cost. I would hope we would continue to revisit that issue, and I know there will be some help through the facility that's created program, but we still need to deal with that. Making someone make 2 years after they've received Social Security disability for health care is just not humane. However, this bill does make improvements in the investments in our health care system so we can provide affordable health care and certain coverage and service to all Americans. Thank you, Mr. Chairman, and I look forward to marking up the bill, and I yield back my time.
Thank you, Mr. Green. Mr. Boyer.
Thank you. I'd like to first associate myself with the comments of Mr. Shadig. I'm a co-sponsor of his bill approving Health Care for All Americans Act. You know, we can do a lot of things to help the American people in health care. You can take a radical idea of what we do to provide insurance for an automobile and say, you know what, maybe we ought to be able to buy our insurance across state lines. Maybe we ought to be able to pool our risks. Maybe, you know, if you're a good driver, you get a good driver discount. Wow, maybe if you take care of your body, you exercise, put yourself into wellness programs, maybe you should pay a less premium. Wow. Maybe somebody that decides to smoke, there's one for you, Mr. Chairman. Someone who smokes, drinks, participates in bad conduct and behavior, unprotected sex, maybe bad things happen to them, maybe they should pay higher premiums. That's a radical thought, isn't it? Well, last night, here's what I did. I decided to, after putting in the full day, and I left my Army Reserve duty at 7:30, I get home at 8 o'clock, I cook dinner for myself and my son. At 9 o'clock, I crawl into bed. I crawled into bed with this, the bill. Now, when I crawled into bed, I did it with a highlighter, a pen, and a pad, and let me just tell you what happened. Now, I am an attorney. It is a very difficult read. I did not have the cross indexes with me. It took me 82 pages in the first hour. So by the third hour, I get to just past the part with the Medicare dish, and then I had to, like, you know, that other side of your conscience, like, gets the whip out and says, no, keep going, keep going. You're like, no, I want to sleep. No, keep going. So I get to the market basket discount, or the market basket updates, and I just say I can't do it anymore. So it's after midnight, and I put it down at page 265. Then we get another one. I guess my point is, if this is what happened to me last night, I don't think any member of this committee has read this. And it is pretty stunning that we're marking up a bill, truly, that no one of this committee has read. Now, I'll continue to do my due diligence. Maybe by Wednesday I'll be able to get through the entire bill. Now, what I do know is that, as I understand this, the migration is truly a scheme to do away with a private insurance market that migrates over 100 million people into a government plan. And when you do that, as we listen to a lot of the testimony, it means less jobs, higher taxes, more taxes, truly, for more government control, more bureaucracy, higher deficits, more debt, less freedoms, less choice, less quality, increased waiting times, and the rationing of care. Welcome to government control of our health care. That means our hospitals get less revenue, and when the hospitals get less revenue, doctors get less revenue because we're going to tie it to the Medicare rates. Guess what? That means pressure comes on the government for more medical research. Less medical research out there means we dull the competitive and innovative edge of American health care. That's bad for patients.
Gentleman's time has expired. Mr. Engel.
Thank you, Mr. Chairman. Today marks a historic day one in which we finally begin reforming our broken healthcare system, a day in which we state unequivocally that allowing 46 million Americans to be uninsured is not only a national tragedy, but has also caused irreparable harm to hardworking families across our districts. Of the 46 million Americans, 80% of them are working people and their families. Today we state our commitment to ensuring that those Americans who want health insurance and need health care coverage are no longer priced out of a system that favors the haves over the have-nots. Today we recognize that beyond our own moral imperative to do right by those who struggle for basic health care services, that it is in the interest of our national economy to reform our health care system. Today is a day in which we support our businesses, which are buckling under the weight of crippling health care costs as well. Mr. Chairman, I want to commend your work, Mr. Dingell and Chairman Pallone, for your leadership over the past 6 months in crafting the bill before us today. This bill will provide comprehensive, quality, and affordable health care for all Americans and controls health costs as well. While I am a proud co-sponsor of H.R. 676, Congressman Conya's bill to create a single-payer system, I strongly support the underlying bill here. However, while I am willing to compromise on single-payer, given the political realities, I must remain adamant that we must retain a strong and robust public health insurance option in this bill throughout markup and conference with the Senate. We must also ensure that the public option will work by creating a provider linkage between Medicare and the public option in the starting years. By doing so, we can provide true competition and choices for all Americans. While there are countless good measures to commend in the underlying legislation, I want to take a minute or so to talk about several of my priorities reflected in the health reform package. I am grateful to you, Mr. Chairman, for your inclusion of a version of my legislation, the Early Treatment for HIV Act, ETHA, in conjunction with the House's proposal to cover all low-income people under the Medicaid program up to 133% of the federal poverty level, is a significant step towards reducing the number of uninsured people with HIV in our country. As you know, because you were the original writer of this bill, ETHA addresses a cruel irony in the current Medicaid system, that under current Medicaid rules, people must become disabled by AIDS before they can receive access to Medicaid-provided care that could have prevented them from becoming ill in the first place. It makes no sense. And because New York remains the epicenter of the HIV/AIDS crisis, it is so important for my state that we do it. And again, Mr. Chairman, I want to commend you and Speaker Pelosi. You had both introduced ETHA many years ago and have been wonderful partners in ensuring that this policy is reflected. And your staff member, Tim Westmoreland, has just been terrific. I also want to thank you for supporting a provision that Mrs. Matsui and I have championed to define and authorize federally qualified behavioral health care centers. As we work to significantly expand the capacity of the public mental health system, it's critical that we update the basic set of services provided by these companies while establishing baseline reporting and quality data. So I want to thank you, Mr. Chairman, and for my colleagues who say this is not a perfect bill, I would say it goes a long way in doing the things that we know the American people want and need. And I thank you, and I yield back the balance of my time.
Thank you, Mr. Engel. Mr. Radonovich?
Thank you, Mr. Chairman. This markup on the committee bill to reform our health care system is ironically entitled America's Affordable Health Choices Act of 2009. It's ironic because the majority chose to use the words affordable and choices in the title of a bill that in reality is neither affordable or provides choice. Our country cannot afford these enormous tax increases on our small businesses, the very businesses we are depending on to create new jobs and lead us out of this recession. Nor should Americans be forced to make choices like meeting all the mandates on coverage created by government or paying new taxes to support the public plan. The bill supplants the sacred relationship between a patient and their doctor with bureaucratic rule and government control. And let's be very clear on that point. This bill is a government coup of the American health care system, a giant leap forwards toward government-run single-payer system. I have serious concerns about the effects on doctors, hospitals, and pharmacies in my district and their ability to provide care based on reimbursements that have already proven to be too low. Access to care is one of the largest health care problems we currently face. It defies logic to think that creating a new entitlement that underpays providers somehow solves this problem. It is not enough to provide new insurance to the uninsured. They have to be able to use that insurance to get care. I am especially concerned about the effect the bill will have on farmers in my district, many of whom will be caught up in the new taxes and mandates on small businesses, severely hindering their ability to provide jobs in the Central Valley and produce the food that feeds our nation. Yet the bill does not account for the unique workforce on our farms. Yet another example of what happens when you take over a complex industry with diverse needs and cram it into a one-size-fits-all box. This approach will not meet the needs of users. Instead, it will drive up health care costs and limit access to care. I wish we had taken the time to work together to fix the problems in our health care system, especially access to care. Instead, we are being forced to meet windows of opportunities to jam through proposals that have not been properly scored or vetted to find out their true ramifications on Americans. This is something I cannot support, and I yield back.
Thank you, Mr. Radonovich. Ms. DeGette.
Thank you very much, Mr. Chairman. Mr. Chairman, the state of our health care system in this country is unacceptable. It's unacceptable that despite the $2 trillion Americans pay for health care every year, twice as much per person as other industrialized countries, the outcomes are abysmal. Americans often think we have the best health care in the world, but consider this. In terms of women's health compared to other countries, the United States ranks 24th. In infant mortality, we rank 29th. In life expectancy, we rank 31st. And for health outcomes overall, we rank 37th, which is just below the Dominican Republic and Costa Rica, and just above Slovenia. Put simply, when it comes to health care, Americans pay so much more, but they get so much less. This is not only morally unacceptable, it's financially unsustainable. It's unsustainable for families who often spend more on medical bills than on food and housing. The fear that just one illness or accident could plunge them into bankruptcy is very real. Medical bills are the cause of more than 60% of all personal bankruptcies in this country, and more than 75% of those people had health insurance. It's unsustainable for businesses, especially small businesses, which have to slash their employer contribution even though they want to do the right thing. It's unsustainable for hospitals, especially safety net hospitals like Denver Health in my district, where a surge of unemployed and uninsured patients have pushed uncompensated care costs above $300 million a year. And finally, it's unsustainable for states, which are overwhelmed by exploding Medicaid costs, including in my own state of Colorado, where the rolls are rising at 33,000 new Medicaid recipients every month. And the status quo is unsustainable for our nation. The more than $2 trillion we spend every year on health care constitutes 16% of our gross domestic product. Over the next decade, without reform, it will swell to 20%. And that's why even the chairman of the Federal Reserve Board, not exactly someone to exaggerate, has called this system broken. There are 3 provisions that are key in this bill today. The first one is auto-enrollment of newborns into Medicaid so that we can make sure we get kids started out right in the first place. Secondly, the bill reinvests in our primary care workforce in the form of student loan repayment programs and workforce training programs. If we don't do that, we won't have the doctors to treat these new patients. And finally, Senator Whitehouse and I have worked on the National Health Care Quality Act. Many of the revisions are included in this bill, which is critically important. Mr. Chairman, inaction, delay, and excuses have led us here today. If we don't enact comprehensive health care reform to address these in the long run, we cannot meet the challenges ahead of us in the future, and that will be simply unacceptable. Thank you.
Thank you, Mr. Gett. Mr. Pitts.
Thank you, Mr. Chairman. Under the proposed legislation, virtually every individual will be required to have health care that meets minimum benefit standards. The bill does not define these minimum benefit standards, but instead establishes a new government health board called the Health Benefits Advisory Committee. This committee, chaired by the Surgeon General and in concert with the Secretary of Health and Human Services, will issue binding decrees on what is or is not considered a minimum federal benefit standard. There is no doubt that this process will result in mandated coverage of abortion, along with federal subsidies for such coverage, unless Congress explicitly excludes abortion. When talking about health care reform, President Obama himself stated that, quote, reproductive care is essential care, basic care, end quote. Secretary Clinton just recently clarified that, quote, reproductive health includes access to abortion, end quote. History has demonstrated that unless abortion is explicitly excluded, administrative agencies and the courts will mandate it. We've seen this time and time again. The federal Medicaid statute was silent on the issue of abortion, but the administration and the courts deemed abortion on demand to be mandated coverage, and it ended up funding 300,000 abortions per year with tax dollars. Then in 1979, Congressman Henry Hyde asked the Indian Health Service where they found the authority to pay for abortions. They responded, quote, we would have no basis for refusing to pay for abortions, end quote. In both of these cases, explicit exclusions had to be added to ensure that taxpayers would not have to continue to pay for abortions. Under this bill, any individual who does not have a plan that meets the minimum benefit standards will be forced to pay an additional 2.5% tax penalty, and any employer who does not provide coverage that meets these standards will pay up to an additional 8% tax penalty. This means that Americans who do not want a plan that pays for abortion will be penalized. In addition to mandating coverage for abortion, this bill will provide massive subsidies for abortion. It will both authorize and appropriate funding for premium subsidies. And without explicit language to clarify that taxpayer dollars cannot and should not fund abortion, massive subsidies for premiums and cost sharings will be used to pay for abortions against the moral objections of millions of pro-life Americans. The issue here is simple. Americans should not be forced to have their tax dollars subsidize abortion, nor should they be forced to be unwitting participants as the abortion industry uses this law to mainstream the destruction of human life into Americans' health care industry. Health care is about saving and nurturing life, not about taking life. Abortion is not health care. The majority of Americans do not support public funding of abortion and should not have abortion coverage forcibly thrust upon them. Thank you, and I yield back.
Thank you very much. Ms. Capps.
Thank you, Mr. Chairman. I first want to thank and commend you, Chairman Waxman, Chairman Pallone, Chairman Emeritus Dingell, for your work on this legislation. I thank all those of you, members and staff, and others for whom this issue has been your life's work. I particularly want to thank you, Mr. Chairman, for your openness during this process. We have had a thoroughly extensive, perhaps even exhausting number of hearings on the topic and on the legislation. And you've been very willing to listen to our concerns and to take into account our priorities as this bill was being written. I was proud yesterday to stand with the President at the White House as he highlighted the nursing community's support of our efforts and listened as he stressed, again, the urgency of passing health reform this year. In fact, one of the elements of this bill, of which I am proudest, is the inclusion of the excellent investments in our nursing workforce, coupled with greater access for patients to nurse-provided services. But that's only one piece of a comprehensive strategy, which will finally take us from a system that focuses on illness-based disease treatment to one that focuses on wellness-based health care. Now, my colleagues have heard me many times, as I did yesterday, address my disappointment in CBO's failure to score comprehensive prevention strategies as a cost savings. But I am still confident the steps we are taking to provide greater access to primary and preventive care and to encourage community-based wellness activities will produce positive outcomes, not only financially, but also morally. And that gets at the heart of what this bill and this healthcare reform movement is all about. A moral obligation to ensure that all Americans have access to quality health care, not just the lucky few. To ensure that every child born is guaranteed access to checkups and vaccines, just like the kid sitting next to him or her in the classroom. To ensure someone with a chronic disease like epilepsy or diabetes doesn't get excluded from purchasing health insurance. To ensure that the loss of a job or a career change or tragic accident or an unexpected illness doesn't mean that you're now then going to do without health care coverage. And to ensure that no one has to decide to forego a meal in order to pay for medication. I'm fortunate to have spent most of my life working as a nurse. Nurses are known as the most trusted of all professions. Fortunately, I fear I gave up this title as I became a politician. So simply put, I urge my colleagues, as the American people do, to trust nurses again when we nurses urge you to support this bill's approach to health reform. Thank you, and I yield back.
Thank you very much, Ms. Capps. Mr. Walden?
Thank you, Mr. Chairman. I just want to make a couple of points. Over the years, I've worked in the state legislature and here in the Congress to increase access to affordable health care, especially in America's rural communities. My district's about 70,000 square miles. I have at least 3 counties that have neither a hospital nor a doctor, and so have tried over the years to expand access to affordable health care and make improvements. I have legislation dealing with critical access hospitals, for example, that would give flexibility in the number of patients they could have in at any given time. If they go over the current cap, they lose that designation. So if you have a flu bug go through a community, they could end up losing their designation if they have more than a certain number of patients in that critical access hospital. I would hope that that legislation could be put into this bill to give them flexibility for a year-long number as opposed to a single-day number. I believe that on MedPAC, that there's an underrepresentation on the membership from rural areas on MedPAC. And MedPAC, as I understand it in the draft, is going to be given significant new authorities. And so that is something I hope we could deal with in this bill as we work to try and improve health care. I think it's important, too, I have a lot of people that have come to me and said, we're concerned about our access to health care because access denied or delayed is access and care denied. And I know that there was for example, on cancer, actually we turn out pretty well in America. There was a study done called Cancer Survival in 5 Continents, a worldwide population-based study published in the Lancet Oncology in August of 2008. And it found in a clinical study examining nearly 2 million patient records in 31 countries on 5 continents, it found that American 5-year survival rates for breast cancer, colorectal cancer, and prostate cancers, we rank first or second in the world among countries with reliable data sets. If you're a woman and you're concerned about breast cancer survival and you live in the United States, you have an 83.9% survival rate. In the United Kingdom, it's 69.7%. Big difference. U.S. prostate cancer survival rate's 91.9%. If you're in the UK, it's 51.1%. And so there are things that work here that don't work overseas in government-run systems. Now, from a process standpoint, several of colleagues on this side of the aisle, like myself, are speaking out about the broken process in this committee. Yesterday, for the first time and the only time, we had the Congressional Budget Office Director before us. Unfortunately, nobody knew about that outside of this committee because the doors had to be closed. Nobody that wasn't a committee staff was allowed in here or personal staff, and no press were allowed. And that's it. And they hadn't even read the bill. The Congressional Budget Office told us they hadn't even read the bill. This is a horrible way to legislate on something that's as critical to the American people's future as getting health care reform right. And so I express my displeasure in that, and my time has expired. My 3 minutes is up.
Thank you, Mr. Walden. Mr. Doyle.
Thank you, Mr. Chairman. We've been tasked with a massive undertaking, the most sweeping reform of our nation's health care system in years. Mr. Chairman, each of us have heard countless stories from our constituents about their problems with our health care system, from patients who are denied the treatments they need, to those who have their insurance canceled, to those who are denied access to health insurance after they lose their job because of a pre-existing condition, to good doctors and medical school students who take issue with the system's disincentives to provide primary care, to hospitals that serve large numbers of our uninsured population, to insurance companies who are crowded out of the market by dominant firms, to consumers who don't understand the information about their health care coverage and treatment options, and countless other stories. Mr. Chairman, your bill attempts to address these issues, and as I said, it's a massive undertaking. As this markup proceeds, I want to make sure that we don't overlook anyone, any family with a disabled child, any person in need of protections that this bill affords. Mr. Chairman, you know how committed I am to making sure that this bill affords families with children on the autism spectrum access to the early diagnosis and interventions that can lead to significantly improved outcomes. I fear that the current bill as written falls short in that area, and that these families and these children may be left behind. That would be unacceptable, Mr. Chairman, and I could never support a bill that left these families behind, as this is a disease that is affecting 1 out of every 150 Americans. Mr. Chairman, you have my commitment that I will continue to work with you during this markup to make sure that we get coverage for these families, that we don't leave anyone behind, and that we get this bill right. It is a massive undertaking. It's very important to the American people that we get it right. I think we should take our time and make sure we do. I look forward to continuing to work with you, and I yield back.
Thank you very much. Mr. Terry.
Thank you, Mr. Chairman. Rising health insurance premium costs are becoming an increasingly heavy burden for American families to bear. Improving access to affordable health care is important. However, creating a public option which puts government bureaucrats in charge of health care in between the doctor and patient is unacceptable. I've heard rhetoric suggesting that you can keep what you have if you like it. However, in reality, this is a government takeover of health care, and keeping what you have will cost Americans a lot more. I conclude that this bill is the pathway to a single-payer, national government-run health plan. I've spoken with businesses in my own district who say that providing health insurance comprises almost 15 to 20% of their costs. An 8% payroll tax is something they would gladly accept to eliminate employee health plans and forcing employees onto the exchange to bear the costs of purchasing their own health care, of which they will likely choose the least cost option, the public option. I'm very concerned that no Republican and most committee Democrats were not allowed to participate in the process of forming this bill, instead creating a chamber of few, an echo chamber of sorts for liberals. Seniors seem to lose the most as Medicare suffers draconian cuts, Orwellianly called savings. For example, home health care suffers a $57 billion hit, which leaves many Nebraskans, mostly rural Nebraskans, without any home health care option, leaving hospitalizations or skilled nursing care facilities the only option, a very costly option. In the next few days, I and few of my colleagues will offer an amendment which would increase the number of insured while still maintaining individual choice and keeping government out of health care. It can be implemented at a fraction of the cost of the Democrats' bill and by expanding infrastructure already there. I'm deeply concerned by the bill's high costs, cuts to important services in the name of savings, and the intrusion of government into health care system. And I'm going to work with my colleagues to try and make this bill a better bill. I'm sure that we have a commitment from the chairman to make sure that all Republican amendments, no matter how meritorious, are beat down and defeated. But we will still try and make an honest attempt to make this a better bill. Thank you again, Mr. Chairman, for holding this markup and allowing me the opportunity to have the first opening statement I've been able to give on health care reform.
I thank the gentleman for his comments, but I look forward to seeing your amendments, and I plan to take whatever amendments I can agree with and support them wherever they come from. So I just want to make that point to the gentleman. Ms. Harmon.
Thank you, Mr. Chairman. As the daughter and sister of medical doctors, I've seen firsthand the importance and challenges of providing quality medical care. My father treated 3 generations of patients in a middle-income neighborhood of Los Angeles. He believed, as I do, that everyone should have access to good health care. To me, this is a core American value, vital to economic competitiveness and urgently needed. A good health care bill will provide universal coverage, foster competition, encourage innovation, and preserve patients' choice. I strongly believe that a robust public health insurance option is essential to achieving these goals. Neither a single-payer system nor an all-private market approach can achieve the results that competition among a robust public option and market-based plans will, and that is central to this bill. We know what happens when insurance companies don't compete. The results range from complacency to price gouging. A public option will help fix this, harnessing the power of the market to drive down premiums, encourage efficiency and quality, and keep bloated treatment regimens in check. By one estimate, it could save the country $800 billion over the next decade. Clearly, insurers are not solely responsible for the current predicaments. Providers, hospitals, and drug companies must shoulder some responsibility. A health care bill should motivate them to become more competitive and efficient. My father made house calls. Imagine that. Those days may be gone, but innovation can harness American ingenuity to achieve the quality and care and level of excellence this country's health care system was once famous for. Let me just mention briefly 4 issues that I hope will be considered as additions to this bill. First, we must lower drug prices. I believe the provision in Medicare Part D, which forbids the government from negotiating lower prices, is a travesty and should be repealed. I also believe we should consider the reimportation issue. Second, we should bolster surge capacity in emergency medical systems by creating a fast track for military medics to become EMTs. With their recent experience administering trauma care in Afghanistan and Iraq, these veterans are ideally suited to respond to large-scale medical emergencies. I will be offering an amendment that's been developed with Mr. Sarbanes and others on this subject. Third, we must protect DISH funds for safety net hospitals serving indigent patients, something very close to your heart, too. These are a lifeline for big city hospitals, particularly those with trauma centers that bear an unequal burden. And fourth, we should consider raising the exemption threshold for small businesses even further. They are the primary economic drivers in our communities and the key to overcoming our present staggering unemployment rates. Mr. Chairman, every member of this committee knows our health system is broken. This bill charts a responsible course to fix it, and I commend you and Chairman Pallone and your hardworking staffs for your work. Now is the time to demonstrate bipartisanship and courage, to honor our Chairman Emeritus, whose name is on the bill, and to live up to the legacy of this great committee. I yield back the balance of my time.
Thank you, Ms. Harmon. Mr. Rogers?
Thank you, Mr. Chairman. I can't tell you how much I'm disappointed at what a lost opportunity we have to, I think, solve a huge problem in health care and access and quality to some, even by your numbers, 46 million, and that's about 15% of the American population. Abraham Lincoln said, you can't make a weak man strong by making a strong man weak. And so what we've decided to do today is abandon the very principles of America and say, you know what, it's so hard and it's so difficult, we're going to punish the 85% of Americans who have earned health care benefits as a part of their employment, and we're going to punish them and the employers who give it to them to try to cover the 15% that don't have it. That doesn't hardly seem like a solution that any of us would come to. Why would we punish the part that's working to cover the part that's not? It's like taking a queen-size sheet and trying to put it over a king-size bed. I will guarantee you the corners are going to come up. That's exactly what we've done here today. And this notion that it's either this or nothing is the chairman's choice. It's the Democrats' choice, that it is either this or nothing. You present us very false choices. And let me tell you about the trade-offs by going to this government-run system. And clearly it is, by the way, in Section 141 under the Health Choices Commissioner Act, they can actually go in and disenroll individuals. Unprecedented power by the federal government. They can rip you off your own individual plan. It's in the bill. Oh, matter of fact, if you're an employer, $250,000 of payroll, that's gross payroll, not much. Guess what? They can disenroll your whole company off a certain plan. Tell me that you don't work for the federal government. Unbelievable. And here's the other trade-off. According to the National Cancer Institute, the National Cancer Intelligence Center for the United Kingdom, and the Canadian Cancer Registry, here's the trade-off that they picked by having government-run health care. If you get prostate cancer, you have a less chance of survivability than you do in the United States. And that's the same for skin cancer, breast cancer, bladder cancer, cervical cancer, kidney cancer, ovarian cancer, is leukemia, and the list goes on and on and on. So what you have said to America is, we give up. It's just too hard. The government has to do it. That's insulting. So what you're going to do is you're going to look your mothers and your daughters in the eye and say, I'm sorry, we couldn't figure it out. We wouldn't allow innovation to do it. We're not going to allow the private sector to fix this problem for us. That's too hard. But I am going to tell you that if you get breast cancer, I'm sorry, honey, you have less of a chance of survival than you did before this bill passed. I will not punish any woman in America to this kind of system, knowing how great America is. The very innovation of who we are is what got us here. And it wasn't the federal government, and it wasn't Washington, D.C. It was individuals who stood up for themselves and said, we can do better. And because of that, we have the greatest middle class in the face of the earth. And this is one more tick in their ability to succeed in America. We've already told them that, gee, your energy prices were too high, middle class. We're going to raise those with cap and trade. Oh, by the way, we're going to tell you what kind of car to drive. We're going to tell you what kind of light bulb you can put in. Oh, I'm going to tell you what kind of window you have to replace your house with. And oh, by the way, now I'm going to pick your doctor and your plan for your future. We must and can do better. This is a travesty, Mr. Chairman, and I yield back my time.
By the way, the gentleman's time has expired. Ms. Schakowsky?
Mr. Chairman, thank you for your leadership in bringing us to this historic day. I, for one, have worked my entire adult life, just about, to win guaranteed affordable quality health care for all people. Because of your work and that of the extraordinary staff, we now have that opportunity. I want to especially thank Chairman Dingell Chairman Emeritus Dingell for his perseverance over 53 years and for introducing this bill. We all know, and we've talked about the crisis in medical care today. 1 out of 3 Americans under age 65 was uninsured at some point during the last 2 years. 1 out of 3. And people with diseases like cancer or chronic conditions like arthritis can't find affordable coverage. And women are being charged higher premiums than men, even for policies that exclude maternity coverage. Small businesses struggling. Individual entrepreneurs can't start their own business. So we have a responsibility as well as an opportunity to act, not just to pass legislation and check it off of our to-do list, but to pass real solutions. Our bill assures the American people that you will not be denied health care for pre-existing conditions. You will not be locked into a dead-end job for fear of losing your health benefits. You will not lose health coverage if you are laid off. We will limit administrative costs so more money goes to patient care. There are so many critical provisions to this bill, from promoting wellness and prevention to improving nursing home quality. I want to focus on the one that has become controversial, and that's the inclusion of a robust public health insurance option that has been mischaracterized over and over again as some sort of a takeover by the government of health care. It will be one option that affords competition. I don't believe that we can meet the needs of our constituents without a workable public option. We can't control costs without it, expand choice, or guarantee secure access. Too many markets in our country, in fact 94% of the markets in our country, according to the AMA, are non-competitive because of the dominance of one or two private insurance companies. Leaving insurance companies to continue to have their way with us for the future means that Americans will continue to live sicker, die younger, and pay twice as much as citizens in most other countries, healthier countries than us. I support a strong public option, and so do 3/4 of all Americans. They don't want to rely solely on the same private insurance industry that is engaged in risk selection, medical underwriting, rescissions, and other abusive practices in order to avoid paying claims and to increase their own profits and CEO salaries. After decades of denials and premium increases, the American public wants the choice of a public health insurance option, and I won't support a bill that doesn't give it to them. So I look forward to its consideration and its enactment this year. H.R. 3200 does provide a public option, and it provides hope for all Americans. Thank you.
Thank you, Ms. Schakowsky. Ms. Myrick?
Thank you, Mr. Chairman. We're here to mark up a bill that attempts to solve a health insurance problem faced by millions of Americans who don't have access to affordable insurance. Some of them can't get it because of pre-existing health conditions or because they've lost their job. For some, an employer has decided that he or she can't afford to offer coverage anymore, and the self-employed have limited ability to buy on the individual market. Some don't get coverage because they don't consider it a priority. Others don't elect to be covered because it's just too expensive. Healthcare costs are holding Americans hostage. Unfortunately, the amendment in the nature of a substitute released last night and before us today doesn't solve these problems. The Congressional Budget Office has not yet been able to indicate a true cost estimate or coverage impact estimate because they've had limited time to analyze the bill. But CBO is able to say that this bill does nothing to bend the cost curve that's been discussed so often in the last several months. This is bad news. A bill that does nothing to change the long-term cost of health care in this country and saddles the federal government and future taxpayers with unsustainable levels of debt is a terrible idea. It's a terrible idea anytime, but it's especially terrible in the midst of a recession. In response to some of these concerns, some of my colleagues will say, well, we must do something. This is true, we must do something. The current scenario can't continue into the future. It's unacceptable that a family of four pays thousands in monthly premium costs when they buy on the individual market. It's unacceptable that medical bills routinely bankrupt Americans who thought their insurance would cover them. And there's no excuse for that. But there's also no excuse for saddling our grandchildren with insurmountable debt, and no excuse for creating a system in which many Americans stand to lose their private coverage. There's no excuse for creating a government health care system that will keep some from getting the life-saving care that they need. And there's no excuse for pushing these massive changes, full of unintended consequences, through Congress just because some think the moment is right.
And I yield back.
Thank you, Ms. Myrick. Mr. Gonzalez?
Thank you very much, Mr. Chairman. This is a historic day for this committee. We are considering legislation that will alter the health care system in this country. I think the majority of us can all agree that our nation's health care system is in a crisis. My home state of Texas has some of the highest rates of uninsured in this country. Over 4.2 million adults, 30% of our population, and almost 1.5 million children, about 21%, are uninsured, limiting their access to necessary medical care. 62% of all bankruptcies are the result of medical bills. Despite having highly advanced technological and an incredibly capable workforce, rates of diabetes and obesity are skyrocketing. The status quo is simply not cutting it. It is a moral and economic imperative that we address this situation with force, not with simply tweaking of a system that is woefully broken. Now, I have heard, as many others on this committee, criticisms of the administration's reform proposals, criticism of what is being considered in the Senate, and of course, criticism of the bill that we will be considering in the coming days. I have heard remarks that this is bad. I've heard this is not going to be effective. My question to the critics is, as compared to what? Our frame of reference is where we are today. Our frame of reference is a system whose results do not reflect the resources, financial, technological, or manpower that we pour into it. Our frame of reference is one in which millions of Americans do not have access to affordable, quality health care. Robert Kennedy said, "There are those who look at things the way they are and ask why. I dream of things that never were and ask why not." I say over the next few days, it is time for us to stop asking why we have a broken health care system and that it is time that we fix it. Thank you, Mr. Chairman. I yield back.
Thank you, Mr. Gonzalez. Mr. Sullivan?
Thank you, Mr. Chairman. I appreciate the opportunity to speak today. I'm strongly opposed to H.R. 3200, the so-called Americans Affordability Health Choices Act of 2009. H.R. 3200 is not true health care reform. It is a $1.5 trillion government takeover of our health care system. This bill has the potential to force more than 1 million Americans off their current private health care plans where they have choices and into government roles with government bureaucrats and advisory boards making health care decisions for all Americans. The ability of Americans to choose their own doctor and health care plan that best fits their needs is in danger of coming to an end. Instead, this bill could ration care and mandate a subsidized, one-size-fits-all government-run coverage model on most Americans. I'm particularly concerned with the number of new government programs that are created in this bill. Rather than improving health care coverage affordability by eliminating waste, spending currently in the health care system, this legislation is adding at least 31 new federal programs, agencies, commissions, and mandates that accompany this unprecedented government takeover of health care in America. This tells me that the Democrats are not serious about taking a hard look at waste, fraud, abuse, and government health care programs currently on the table. The majority claims that the government-run plan will compete on a level playing field with other health care plans. However, there is nothing in the bill that suggests that be true. The government plan will pay Medicare rates, and it won't be subject to a whole host of costs and liabilities that other private plans must face. H.R. 3200 also includes several damaging new employer mandates that will raise the cost of doing business even higher by penalizing employers, including millions of small businesses who cannot afford to pay for health care. These new mandates will mean even fewer jobs. The Democrats like to talk about this bill as an economic driver, but according to the National Federation of Independent Businesses, they recently warned that 1.6 million jobs could be lost as a result of an employer pay-or-play mandate on small businesses. We can all agree that our nation's health care system is in need of reform, but it should not come at the expense of our nation's small businesses. I look forward to examining this legislation in greater detail during what few days the majority has provided us to examine the largest government takeover of our health care system in our nation's history. And I yield back the balance of my time.
Thank you very much, Mr. Sullivan. Mr. Inslee.
Thank you, Mr. Chair, and thanks for being so stalwart on this after the energy bill to get this up and running. We appreciate your work. Several people have referred to Harry Truman. Harry Truman started this dream of giving Americans coverage, but he did another thing that was pretty remarkable in the 40s. He reformed the way we did military procurement and prevented a lot of what you might consider waste. And he saved taxpayer dollars. And I believe we've got a lot more work to do on this bill to, in fact, really reduce the amount of overutilization that goes on that endangers the quality of health care that our constituents have and costs the taxpayers billions of dollars. When we started this effort in the early 90s, health care was 7% of the economy. Today it's 16%. It'll go to 40% by 2040. This will be a monster that will devour the United States economy if right now in this bill we do not succeed in adopting rational health policies that are based on quality of care rather than just churning services. Right now we have many perverse incentives. Let me suggest 5 or 6 things we hope to accomplish in this bill. Number one, we'll have peer review so that physicians are subject to peer review of their work. And we seek in this bill to make sure that we move to accountable care organizations like the one my dad just benefited from after his surgery, where he didn't have to go into an ER room because we had an accountable care organization that had processes so we could talk to the nurse at 3 o'clock in the morning. Number two, we ought to bundle our payments so that we pay based on the condition of patients rather than the service provided. We know there are enormous savings to be had in this regard. We ought to require moving in that direction, not with pilot studies, but in fact with binding commitments. Number three, we need bonuses for doctors that will in fact follow protocols. We have protocols on how to practice medicine. Physicians who agree to follow them ought to get a bonus in their Medicare and public option payments. Three, those outliers who are substantially way beyond accepted utilization rates ought to have some method of giving them an incentive to come back into accepted rates of utilization. Number five, we ought to have a value-based system when we do cost structure of our benefits. We ought to base it on value patients get, not just on the cost associated with treatment. If we do those 5 things, we will fulfill our mandate, in fact, to bend the cost curve down. I'm not very confident the cost curve is going down right now. It could be going in the opposite direction. So I look forward to working with everyone on this committee to finding a way that we will fulfill that commitment and look forward to that success. Thank you.
Thank you very much. Mr. Murphy.
Thank you, Mr. Chairman. After 25 years in the healthcare field, I came to Congress with one overriding goal: to improve our nation's healthcare system. Mr. Chairman, I know you share the same passion for reform. I'm grateful for your willingness to work with me on preventing healthcare-acquired infections. I've doggedly pursued this issue year after year, and I'm grateful to see it included in the draft. Thank you for your leadership. For too many years, however, Congress has been talking while hundreds of thousands have died from mistakes and preventable problems in healthcare, and trillions have been wasted. Bad medicine is bad policy. Many Americans are unhappy with the cost of health care, and there's much we can do. How do we address these concerns and address these long overdue reforms? Well, I'm eager to support a bill that first makes the safety and quality and cost of health care transparent. It's sad that you can get more information from Consumer Reports magazine on a washing machine or toaster than you can on those who hold your life in their hands. Imagine a system where you can indeed find out about your doctor's experience and your hospital's track record and costs. Second, let's be honest. There is no competition right now in the private insurance marketplace. Mandates, legal complexities, coverage policies, and bureaucracies lead to huge differences in costs from state to state. There are so few choices that in some regions there may only be 1 or 2 policies to choose from. Imagine the power and confidence you would have if you could shop across the nation for health care insurance from a list of companies and plans to suit your needs. Third, we can encourage competition and affordability by requiring all health insurance companies to offer at least one basic plan you can compare that allows you the comfort of knowing you won't go bankrupt if you get sick. Imagine if you could purchase a plan that at least covers a doctor visit, emergency care, and catastrophic care, a plan you could add on to if you choose. Fourth, we can make health care more affordable for small businesses and families and individuals by allowing them to join into groups, not limiting them to a policy of one or two big monopolies. Fifth, we have to recognize for those who live close to the edge of their income, a little help can go a long way. For those that need some assistance that are above the income levels of Medicaid, below Medicare, we can help through direct subsidies, vouchers, or tax breaks. On a sliding scale based on income, we can give people the kind of assistance they can afford. Imagine what you could do if you received a subsidy to do this, or your employer could offer assistance, even for those making lower wages. Sixth, the coverage should be permanent. No more getting cut off when you get sick, no more getting kicked out if you switch jobs. Imagine a plan that takes an interest in your long-term health because you're part of the long-term plan. We should try to make these changes before we create an expensive government health insurance company. Bad policy is bad medicine. While we are trying to get out of this recession, I do not like the idea of raising $750 billion worth of taxes to support a government company. Imagine a plan that is based on barriers, burdens, and bureaucracy. That's what we could have. But instead, let's look at one that makes it personal, portable, permanent, and affordable. I will support a bill that makes those changes. Thank you, Mr. Chairman.
Thank you very much, Mr. Murphy. Ms. Baldwin.
Thank you, Mr. Chairman. Health care for all is part of the American dream, and it's a part of the American dream that has gone unfulfilled since the mid-1940s, when John Dingell Sr. first proposed it in Congress, and Harry Truman was the first president to propose it. And how many people have suffered? How many families have been bankrupt? How many business plans have been deferred? How many futures denied because we do not have affordable, accessible, quality health care for all? For the first time in more than 6 decades, as we begin to transform our economy and reclaim our stake in the American dream, health care for all is within our grasp. The people I represent are worried about the economy. Now more than ever, they are worried about getting a good job, keeping a good job, and providing for their families. They also know that reforming health care is one of the most important aspects of our national economic recovery. As a consequence, health care is the issue I hear more about than any other issue, the issue whose painful personal stories move and motivate me day in and day out. This bill delivers on the promise of reform, lowering costs, offering choices, providing better care to more, and making our insurance industry competitive and fair. We will act to prevent insurance companies from denying people coverage because of a pre-existing medical condition. We will ensure that workers can still have health care even if they lose their job or change their job or start a new business. We include a health care insurance exchange that will allow families and small businesses to compare prices and quality so they can choose the health care plan that best suits their needs. I have long championed the role of states in reforming our health care system. This bill permits states to operate their own health insurance exchanges, addressing the needs of their residents with an understanding of local insurance markets. This bill empowers the states with new prevention and wellness funding to look at new ways to address population health. I have also long championed efforts to address health disparities. So I'm proud that this bill creates a new critical position, the Assistant Secretary for Health Information, and empowers her to collect meaningful data across a range of populations to better inform our efforts to reduce disparities in health outcomes and delivery. Through this markup, we will hear the voices in opposition to this legislation. We will hear from the naysayers, the cynics, and the keepers of the status quo. But the status quo is not sustainable. Just listen to your constituents. Real health care reform, transformational reform that includes a public plan is within our grasp, and we must seize this moment. Thank you, Mr. Chairman, to you for your leadership and your tireless work on this, and a special thank you to your staff also. I yield back.
Thank you, Ms. Baldwin. Dr. Burgess? Is your mic on? It says it's on. No.
I've been waiting to move up here anyway. Well, thank you, Mr. Chairman. I know you peer out from the top of the dais there. You look over this side of the dais and you see nothing but no votes. And that might be true, but it didn't have to be that way. I'm not saying we would have agreed on everything, but there are some of us who know what it's like to argue with an uncaring insurance company to get a patient the most basic level of care. There are some of us who know what it's like to see an expectant mother in labor and delivery in the middle of the night with no real problem other than the fact that she's not been able to get prenatal care and needed reassurance that the baby was okay, and so she chose the most expensive way to do it. There are those of us, you strip away the politics, who believe we need to do something to address access to our health care system. We absolutely do have serious issues, and I agree. They require our attention. Now, maybe you could have had my vote, maybe not, I don't know. What I do know is you never tried. And that's a shame. It's a shame to those who might have concerns about some policies, but also realize improvements need to be made. When we talk about access to care, I think most Democrats on the committee genuinely care about the issue as I do. It is unfortunate. I believe this bill will actually hurt access to care. Will it help some? Maybe. Will it hurt some? Probably. And what about the cost? Cost is a problem because we just don't know. Yesterday, we had a meeting with the Congressional Budget Office. The doors were closed. Press was excluded from the room. All the bright lights were turned off. And we heard about the numbers that are often quoted in the press. But now we know those numbers are a sham. They were based only on a part of the bill and really only on a staff description, not on legislative text. Now, I had a professor at Parkland Hospital who used to tell us when we were presenting cases, and they might have an air of disbelief about them, the chairman would say, if you're going to tell a story, at least start it out with once upon a time so I'll know what you're doing. We should have done that yesterday with the Congressional Budget Office. And even still, the score tops $1 trillion, probably $2, probably higher, and still leaves 17 million people uninsured. We haven't even talked about the people who are in this country without the benefit of a Social Security number. The spending really doesn't start until year 5 and spirals upward. And what will it be in year 11, year 20? I think we're in for a real shock when we get a real score on a real bill. And this is important. Think of the men and women who were here in 1965 who designed Medicare. What if they had taken the time and trouble to look ahead to the year 2009, to the year 2017? Well, here's what we do know. This bill does nothing to deal with defensive medicine as a result of the liability system that's driven by unnecessary lawsuits. It does not seize the monumental opportunity to reform Medicaid for our neediest citizens. It seems to tip the hat to some fundamental problems, and that adds 15 million new Americans to the roll, essentially making the problem from bad to unmanageable. Medicare payment is still allowed to fluctuate, leaving our nation's seniors unsure whether their doctor will be able to see them next year, and unfortunately, despite some provisions, the bill does not make the generational investment into the physician workforce that will be needed to ensure that everyone who is provided coverage on the bill can actually see a doctor. Can I tell my constituents their costs will go down or they'll get to keep what they like? I can't. I wish I could. Mr. Chairman, I didn't start out as a no on this bill. I was not a default no when we started this process. But where we've gone and where we've ended up, I have no other choice. I'll yield back the balance of my time.
Gentleman from Arkansas, Mr. Ross.
Thank you, Madam Chairman. I'm committed to passing health care reform that lowers cost and improves quality for all Americans. I sit here today ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. Our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it is leading this country down a path to fiscal disaster. Our current system is riddled with inefficiencies and waste, maligned incentives and increased cost, and failed to reward high-quality care. However, we cannot fix these problems by simply pouring more money into a broken system. Here is what we must do. Find every penny of savings within our current public programs and ensure we get more value for every health care dollar we spend. Be more aggressive in implementing innovative delivery reforms to bend the cost curve. And provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, Blue Dogs have put forth substantive policies in order to achieve common sense and bipartisan health care reform. We look forward to working through the markup to incorporate them. We have an historic opportunity to transform our health care system into one that meets the needs of all Americans. We cannot pass up this moment without fundamentally changing the incentives in our system to reward high-quality, efficient health care. And with that, Madam Chairman, I'll yield back the balance of my time.
Gentleman yields back. Gentlelady from Tennessee, Ms. Blackburn.
Thank you, Madam Chairman. I thank you for the opportunity to raise my concerns on this bill. My colleagues have all spoken eloquently on the ramifications of the outrageous cost and the impact of government micromanagement of our healthcare delivery system. I could only repeat what they have said. My concern is over the repetition of history that I see unfolding before me. What might seem like bright new policies in Washington, D.C. are really reminiscent of the painful past in Tennessee. There is a test case for public option government-run health care, and it was an apocalyptic failure. Tennesseans have been down this road, and we do not want our nation to go down the same road. For more than a decade ago, when Tennessee introduced managed care to replace Medicaid, we were promised cost savings, deficit neutrality, more and better health care for all. We wound up with a program, TennCare, that consumed every dollar of new revenue and almost bankrupted the state. We have had a decade of court orders, consent decrees, budget battles, and funding fights. Education and economic development priorities have been set aside just to fund TennCare. And during the process, what happened? Well, guess what? Quality of care declined. The cost skyrocketed. Rationing of health care ensued. Access was closed, and patients were actually removed from the program. We cannot afford to spread the missteps and the problems of TennCare on this nation. Do I think that some components of the health care and medical care delivery system should be reformed? Yes. But it should be done in a way that can reduce cost, yield more options, allow greater choice, use market forces, and yield an affordable, accessible, patient-centered system. Mr. Chairman, I strongly urge my colleagues, and indeed even the reporters that are covering this hearing, to think about something. Take a look at the lessons that we learned from TennCare. Ask yourself and ask the bill's sponsors how they have learned from a program that even our Democrat governor called, and I'm quoting, a disaster. Ask them before we commit 17% of the nation's GDP to the same plight. Debt incurred is opportunity denied. Tennesseans are still cleaning up after the TennCare debacle, and any Tennessean can tell you how many opportunities we have been denied because of it. Thank you, and I yield back the balance of my time.
Gentlelady yields back. Gentleman from New York, Mr. Weiner.
Thank you very much, Madam Chair. You know, to some degree, this debate back and forth is utterly predictable. When we in Congress passed the Medicare Act and the Social Security Act, we heard the exact same objections from our colleagues on the other side of the aisle. I can tell you this. If we do this right and we pass this bill, all Americans, even the very well-to-do, are going to pay less. They're going to pay less, and I'll tell you how I know that. Because right now we are spending $1.2 trillion a year on insurance and for out-of-pocket for people who don't have insurance. That's not even counting what we're paying in additional taxes to provide care for the uninsured, which in New York City alone is $3 billion a year. You know, everyone says, oh, well, you're going to provide more taxes, you're going to strangle the economy. What's happening now? Do you not think we can get a 10% reduction in those costs? If you do, you know how much that adds up to? It adds up to $1 trillion over 10 years. And then I hear my colleagues complain about government-sponsored health care. You know what? I am half tempted to offer an amendment to eliminate Medicare. And what would you do? What do you think Medicare is? It's government-sponsored health care, and it's one of the most popular programs around. Now, it's got problems, and we should fix it. But all of the concern, well, the public option is going to crush private insurance. Do you think consumers are not smart enough to choose the best one? And if they choose the public option, doesn't that tell you something? Are your constituents only smart enough to vote for you, but they're not smart enough to pick a health care plan for themselves? I think they're pretty smart. So let's set up a competitive model and see what works. You know, all of this has me thinking, what's the good of the private option? What is that doing? What is private insurance company? Name a single thing a private insurance company does to make anyone healthier, to save anyone money. Health insurance companies operate like they're supposed to. They're businesses. They operate to make profits. How do you make profits? By giving away as little and collecting as much. It's the opposite of the imperative that we have as the representatives of the people. But this is so utterly predictable because you didn't vote for Medicare. Your party didn't vote for Social Security. You said, let's just hold. You had control of the House, the Senate, the judiciary, the presidency for 8 years, and you didn't do anything. Except, no, I shouldn't say that. You passed Medicare Part D, which said, let's see if the private insurance, if we give them enough money, whether they'll do the right thing. Donut hole, anyone? You know, this is like Jabberwocky, which was the language spoken in Alice in Wonderland. Isn't that right, Ms. Baldwin? Through the looking glass. You know, if you say these words enough, sooner or later they take on a little life of their own. Well, you can feel free to do that, but the American people know you're standing in defense of a system that everyone knows is broken, everyone knows is too expensive, everyone knows doesn't work, and we were elected to change that. I yield back.
Gentleman from Georgia, Mr. Gingrey.
Madam Chairman, having practiced OBGYN for nearly 30 years, the reform of our health care system has been my single biggest legislative goal since coming to Congress. That's why the pill that lies before us is so painfully bitter to me. We are in unprecedented economic times. Millions of Americans are without quality health care, including those with chronic illness and low-income families that cannot afford coverage. Additionally, job losses are mounting. Last month, 450,000 more Americans lost their jobs, bringing this year's total to 2.5 million. Madam Chairman, the need for reform can be summed up no better than by President Obama's remarks to my physician colleagues in Chicago last month when he said, "The cost of our health care is a threat to our economy. It's an escalating burden on our families and businesses. Indeed, it is a ticking time bomb for the federal budget." Yet just yesterday, the CBO, Congressional Budget Office, said that this bill does not reduce the growth of health spending. And Director Elmendorf said it again today in testimony before the Senate Budget Committee. So what will this bill do? It's hard to say, as members of Congress and the public have only had a little more than, 12 hours to read this massive bill, more than 1,000 pages, which fundamentally changes our health care system. Nonetheless, let me present some of the highlights. Mr. Chairman, the bill forces every American to purchase health insurance or pay a 2.5% tax, regardless of their income, and taxes every health insurance plan to pay for this so-called comparative effectiveness research. It also imposes an 8% tax on businesses if they cannot afford to offer their employees insurance, resulting in major job losses and millions losing the health care they have today. Actually making poppycock of the Obama pledge, if you like the health care you have, you can keep it. And another pledge, no one earning less than $250,000 will see a tax increase. Mr. Chairman, this bill will not lower the cost, nor will it improve the quality of health care in our country. It will, however, allow bureaucrats to take over the health care system, sell government-run insurance that American patients inevitably must buy, and tell patients what treatments they ultimately can receive. I agree with Mr. Markey. This bill does apply CPR to our current health care system. It cancels patients' rights. For the sake of every American, Mr. Chairman, Madam Chairman, we must strive in a bipartisan manner find a real and a sustainable solution for our health care system. A one-size-fits-all government plan simply will not work, and it'll bankrupt this country. This bill will not only rob the American people of their health care choices, but it will force them and our future generations to foot the bill. And I yield back my 5 seconds.
Gentleman yields back. Gentleman from Utah, Mr. Matheson.
Thank you, Madam Chair. I'm committed to passing health care reform that lowers costs and improves quality for all Americans. And I sit here today ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. Our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it is leading this country down a path to fiscal disaster. Our current system is riddled with inefficiencies and waste. Misaligned incentives increase costs and fail to reward high-quality care. However, we cannot fix these problems simply by pouring more money into a broken system. Here's what we must do. Find every penny of savings within our current public programs and ensure we get more value for every health care dollar we spend. Be more aggressive in implementing innovative delivery reforms to bend the cost curve and provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, Blue Dogs have put forth substantive policies in order to achieve common sense and bipartisan health care reform. We look forward to working through the markup to incorporate them. We have an historic opportunity to transform our health care system into one that meets the needs of all Americans. We cannot pass up this moment without fundamentally changing the incentives in our system to reward high-quality, efficient health care. I'll yield back my time.
Gentleman yields back. Gentleman from Louisiana, Mr. Scalise.
Thank you, Madam Chair. The bill before us, H.R. 3200, constitutes a massive government takeover of our health care delivery system, leading to rationing of health care for Americans, hundreds of billions of dollars, and new taxes on the backs of American families and small businesses, and will lead to government bureaucrats interfering in the relationship between patients and their doctors. At a time when politicians and bureaucrats here in Washington are exerting unprecedented level of government intrusion into the everyday lives of our society, the secretive way which this bill was drafted with hearings closed to the public is an insult and a disservice to the American people who expect and deserve transparency from Speaker Pelosi and the Democrats running Congress. Just this morning, the CBO's director testified that this government takeover of health care will increase federal spending significantly without the corresponding savings that were promised. If the past 7 months have proved anything, it's that this liberal agenda is profoundly removed from the ideals of the American people and the ideals that our country was founded upon. From the so-called stimulus that puts $787 billion in debt onto the backs of our children and grandchildren and has led to our unemployment rate approaching double digits, to the cap-and-trade energy tax, which will impose over $1,300 in higher utility bills on American families while running millions of jobs overseas. The liberals running this Congress have proven to be completely out of touch. No one disputes that our health care system needs reform. We need to make health care more affordable. We need to improve access to quality health care. We should place more emphasis on primary and preventive care. And we need to bring health care costs down by ending frivolous lawsuits and rooting out waste, fraud, and abuse in the system. But you don't destroy all the things that work in order to fix the problems that exist. This bill will result in the rationing of critical life-saving medicine to our nation's seniors and will result in millions of people losing their current health plans and billions in new taxes at a time when our economy can least afford it. This bill represents a war on the middle class. On a number of occasions, President Obama has said if you like the health care plan you can keep it. But in Section 102 of his bill, right here, they allow the government health care czar in Washington the ability to kick you out of your plan if he determines it to be out of compliance with new national mandates. If President Obama truly stood behind his pledge to the American people on health, he would oppose this bill. President Obama also pledged not to raise taxes on anyone making under $250,000. In Section 401 of the bill, right here they impose new taxes on American people, including $29 billion in taxes on the uninsured. If President Obama truly stood behind his tax pledge, he would oppose this bill. Clearly, there are big problems with this bill. It will result in millions of people losing their current health insurance. It will ration health care to our most vulnerable populations while imposing more than $800 billion in new taxes and penalties on American families. And the health care czar will be able to ration care and take away your plan even if you like it. The president's now running banks. He's running car companies. And his stimulus bills cause 2 million more Americans to lose their jobs. considering how poor of a job the federal government is doing at running private companies and managing the economies, imagine what American health care will look like if the federal government takes over the health care system. I yield back.
Gentleman's time's expired. Gentleman from North Carolina, Mr. Butterfield, is recognized.
Thank you very much for recognizing me. Let me just take a moment to thank the chairman of this committee, Mr. Waxman, and the chairman of the subcommittee, Mr. Pallone, for their extraordinary leadership. They've worked so hard on this bill, and I am pleased to publicly say to them that we thank you for your leadership. Also, the chairman emeritus of this committee has been so visionary. But today, Madam Chairman, marks a very historic day for this committee and for the U.S. Congress. The American people have made it abundantly clear. They want health care reform, and they want it now. And today, we are one step closer to delivering on that request. H.R. 3200 takes a bold step toward reforming an outdated health care system that has proven ineffective in its delivery and, as we all know, quite expensive. I commend President Obama for providing the vision and the leadership for making health care reform a priority, and for realizing that failure to address this issue will impact the long-term global competitiveness of this country. This legislation provides for the creation of a public exchange, a marketplace, if you will, for Americans to go and find a plan that fits their needs. The legislation makes prevention and wellness a priority and establishes a minimum benefit requirement. Annual out-of-pocket expenses would be capped. Coverage denials for pre-existing conditions and the lifetime limits on how much insurance companies will pay would be eliminated. I can tell you, for the people that I represent in rural eastern North Carolina, this legislation is essential. Over 17% of North Carolinians are uninsured. Over the past 8 years, families in my state have seen their health insurance premiums rise 5 times faster than their wages. According to the census, more than 1 in 6 people in 8 of the counties that I represent are uninsured. H.R. 3200 does have its shortcomings. The legislation does not provide adult dental care as a basic minimum benefit. The bill could also go much further in addressing the elimination of health disparities. And so, Mr. Chairman, I want to thank you for putting together this legislation. I know it's not perfect legislation, but I want to thank you. I particularly want to thank you for working with me to expand the telehealth provisions, first outlined in the discussion draft. Telehealth involves the use of technology in diagnosing and treating chronically ill Medicare patients, particularly those in the remote and rural communities like the one that I represent, and it works. So thank you, Mr. Chairman, for your extraordinary work. I look forward to the next 4, 5, 6, 7 days of markup, whatever it takes. We're going to deliver a good package to the House floor for consideration. Thank you, and I yield back.
Gentleman yields back. Gentleman from Louisiana, Mr. Melanson.
Thank you, Madam Chairman. I'm committed to passing a health care reform that lowers costs and improves quality for all Americans, as I think that we all are here in the Congress. I'm here today ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. I believe our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it is leading this country down a path of fiscal disaster. Our current system is riddled with inefficiencies and waste. Misaligned incentives increase costs and fail to reward high-quality care. However, we cannot fix these problems by simply pouring more money into a broken system. And here's what we must do. First, find every penny of savings within our current public programs and ensure we get more value for every health care dollar that we do spend. Be more aggressive in implementing innovative delivery reforms to bend the cost curve. And last, provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, the Blue Dogs have put forth substantive policies in order to achieve common sense and bipartisan health care reform. We look forward to working through the markup to incorporate these same policies. We have an historic opportunity to transform our health care system into one that meets the needs of all Americans. We cannot pass this moment in time without fundamentally changing the incentives in our system to reward high-quality and efficient health care. What we do here in this 111th Congress will be easily judged at a future date. My hope and my wish is that everyone and their constituents, my children and my grandson, will be able to appreciate over all of our efforts, but more importantly, that they will benefit from our efforts. It is of utmost importance that we take our time to get this thing right. To fail now would be a failure we can never reverse, and a legacy we and future generations can ill afford. I yield back my time and thank the chair.
Gentleman yields back. Gentleman from Georgia, Mr. Barrows, recognized.
Thank you, Madam Chair. I'm committed to passing health care reform that lowers costs and improves quality for all Americans. And I sit here ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. Our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it's leading this country down a path to fiscal disaster. Our current system is riddled with inefficiencies and waste. Misaligned incentives increase costs and fail to reward high-quality care. However, we can't fix these problems by simply pouring more money into a broken system. Here's what we must do. Find every penny of savings within our current public programs and ensure we get more value for every health care dollar we're spending. Be more aggressive in implementing innovative delivery reforms to bend the cost curve, and provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, Blue Dogs have put forth substantive policies in order to achieve common sense and bipartisan health care reform. We look forward to working through the markup to incorporate them. We have an historic opportunity to transform our health care system into one that meets the needs of all Americans. We cannot pass up this opportunity to fundamentally change the incentives in our system to reward high-quality, efficient health care. And with that, I yield back.
Gentleman yields back. Gentleman from Indiana, Mr. Hills, recognized.
Thank you, Madam Chairman. I am committed to passing health care reform that lowers costs and improves quality for all Americans. I sit here today ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. Our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it is leading this country down a path to fiscal disaster. Our current system is riddled with inefficiencies and waste. Misaligned incentives increase costs and fail to reward high-quality care. However, we cannot fix these problems by simply pouring more money into a broken system. Here's what we must do. Find every penny of savings within our current public programs and ensure we get more value for every health dollar we spend. Be more aggressive in implementing innovative delivery forms to bend the cost curve, and provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, Blue Dogs have put forth substantive policies in order to achieve common sense and bipartisan health care reform. We look forward to working through the markup to incorporate them. We have an historic opportunity to transform our health care system into one that meets the needs of all Americans. We cannot pass this one moment without fundamentally changing the incentives in our system to reward high-quality, efficient health care. I yield back to the balance of my time.
Gentleman yields back. Gentlelady from California, Ms. Matsui.
Thank you, Madam Chair. I want to thank Chairman Waxman, Chairman Pallone, and Chairman Emeritus Dingell for their leadership on this most important of bills. Over the last few months, I visited community clinics, hospitals, alcohol treatment centers, and emergency rooms in my hometown of Sacramento. I've seen how much of our healthcare system works for the people in my district and across our country. Integrated models of care, community-based interventions, comprehensive treatment programs for the mentally ill. All of these are key components of a well-functioning health system. But the glue tying these together is hardworking and extremely skilled doctors, nurses, pharmacists, therapists, and public health workers who live in my district and who drive its economy. I've met with many of these healthcare workers, and I've seen their dedication and commitment firsthand. But they need help. Our healthcare system is overwhelmed with demand, even as millions of our fellow Americans have no health insurance. One of the most effective strategies to ease the stress and strain on our healthcare system is to invest in public health and prevention. That is why I'm so pleased that two pieces of legislation I introduced earlier this year were incorporated into the underlying legislation the committee is considering here today. The Public Health Workforce Investment Act and the Wellness Trust Act are important components of a comprehensive healthcare system that help to make America a healthier, stronger, and more competitive country. Another way we do this is by providing quality health care to our children. Our children are our future, and I'm committed to working with my colleagues on this committee to ensure that we first do no harm when it comes to children's care. I also want to thank Chairman Waxman and the committee staff for working so closely with Mr. Engel and myself on language creating a new definition of federally qualified behavioral health centers. In the end, Mr. Chairman, Madam Chair, I support this legislation because of people like Claire Josephson. Claire is an uninsured constituent of mine, a nurse with diabetes. As the cost of medicine goes up, she will not be able to afford medication for very much longer. So even though this legislation is not perfect, I believe the underlying bill is strong and will go a long ways to help people like Claire, our children and grandchildren, and the millions of Americans across our country. Madam Chair, inaction is not an option. We must address comprehensive health reform now. Thank you, and I yield back the balance of my time.
Gentlelady from the Virgin Islands, Ms. Christensen.
Thank you, Madam Chair. As we prepare to take this momentous step to reform the healthcare system in this country, it's a bittersweet moment for me and my fellow delegates who represent the offshore areas of the United States. It's sweet, of course, because due to your hard work and the dedication of Chairman Waxman, Chairman Dingell, Chairman Pallone, and that of our House leadership and our President, many others, quality health care, including prevention services, will finally be accessible to the tens of millions of Americans who today are uninsured. But the bitter pill for me and the others is that as of today, despite the funding provided, which we do appreciate, the territories will not be afforded the same access in Medicaid, Medicare, and the exchange. It is my hope that we can still continue to work to rectify this inequity for the 4.5 million Americans who love this country and faithfully serve it, and on behalf of the Puerto Ricans, Virgin Islands, Guamanians, Samoans, and Northern Marianans who have given their lives on all of our behalf. America's Affordable Health Choices Act presents a bold and important step forward, and there's much to applaud in this bill. My other colleagues have spoken of many of them, but I would like to focus on those of which are of particular importance to people of color who continue to experience severe health disparities and premature preventable deaths every day. In that regard, I applaud the efforts to not only expand but to diversify the health workforce, to improve data collection, to provide translation services, to include the territories in the federal poverty level study, to expand community health centers, and the attention paid to community-centric prevention efforts. We're also pleased with the expansion of the National Health Service Corps and loan repayment programs, the fix for the doctor's Medicare reimbursement rate, and the efforts to strengthen Medicaid and Medicare, which will incentivize providers, especially those who dedicate their lives to providing care in our nation's most underserved communities. At the very outset of this process, the CBC and the entire Tri-Caucus made it clear that health disparity elimination needs to be integrated throughout the bill, and while much has been accomplished, there are still areas that we need to improve upon. Among these are strengthening the anti-discrimination language, restoring coverage to ex-offenders, elevating the National Center on Minority and Health Disparity Research to an institute, improving the CER provisions, and including dental in the basic package for adults, as well as improving the treatment of the territories. We continue to stress the importance of including language requiring racial and ethnic diversity on all of the councils, committees, commissions, and task forces created or referenced in the bill. If diverse voices and points of view are not at the decision or policy-making table, history has shown that the concerns of every American will not receive due consideration. Finally, I feel we are falling short of the best bill we could have by not using the savings that all of us know will be realized from the steps we will begin to take when the final bill becomes law to ensure that everyone, everywhere, receives all of the necessary health care services to enable them to be well and to lead productive lives at their fullest potential. At the very least, I would like to see that we provide some language that as these savings are realized, at least a portion of them will be used to provide some of the services that will still be left out at the end of this this process, including bringing the territories to parity in Medicaid. I have several amendments I will offer. I look forward to working with you, Madam Chairman, our ranking member, and my colleagues to work to have them included in the final product.
Gentlelady's time's expired. Gentlelady from Florida, Ms. Castor.
Thank you, Madam Chair. America's Affordable Health Choices Act will reduce the cost of health care for America's families and improve the health of our great nation. Chairman Waxman, Dingell, and Pallone have been inclusive and open-minded, and on behalf of the hundreds of thousands of folks I represent, I thank them for including many of the reforms I have advocated on behalf of Floridians and all American families. I also thank my colleagues for their broad-based collaboration on this historic legislation. The health of our families and our neighbors is fundamental. But over the past decades, paying for health care has gotten to be too expensive. Insurance premiums have risen 3 times faster than wages. Insurance companies have raked in billions in profits. They've played games with people, and they've left folks with pre-existing conditions out in the cold. Meanwhile, some Americans do not take personal responsibility for their health like they should, and we all end up paying their health care costs when they show up at the ER with complicated and costly conditions. But we're not going to give up, and we're not going to give in to the naysayers and the special interests. And it is clear that President Obama is not going to give up. We're going to build on what works and fix what is broken. Our bill ensures that 97% of Americans will be covered by a health care plan that is both affordable and offers quality standard benefits. This is critical to my home state of Florida. It's a large state that's a microcosm of the nation. We are urban and rural. We are diverse. And we have a serious health care crisis. 2 out of every 5 Floridians do not have health insurance. That's 38% of the population of my state. And the overwhelming majority are working families who are doing everything right, but health care in America is broken for them. But now there is hope. You know, I've spoken with so many who are holding off on necessary medical services that are in their 50s or early 60s. They're just holding on until they turn 65 and they qualify for Medicare, praying that they get there. And for the families who have health insurance, the costs are going up, up, and up, and they simply can't afford it anymore. But this innovative bill provides solutions for those families, a uniquely American solution to control costs and put patients first without burdening future generations with debt. We're going to stop the denials of care based on pre-existing conditions, race, and gender. And I'm convinced that one of the ways we're going to rebuild our economy and put people back to work is through a modern health care workforce in new community health centers and conveniently placed clinics throughout our neighborhoods. This frontline workforce of primary care professionals will do a world of good for these students seeking job opportunities in today's economy. Our community colleges and universities will do very well as well. In closing, I'd like to thank Representative Green and all of the members who work to cut bureaucratic barriers for families who need to take their kids to the pediatrician under S-chip. We're going to stand up for those families all across America and put a stop to these skyrocketing premiums and deductibles and ensure that every American has the same opportunity to lead a healthy and productive life.
Gentlelady's time's expired. Gentleman from Maryland, Mr. Sarbanes.
Thank you, Madam Chair. First of all, I want to salute the staff of the committee for just the incredible work over so many days, which I know is going to continue, and for being so gracious to all of us who are trying to get our ideas worked into the mix. This is a big bill. It's a complex bill. There's no question about it. But, you know, many of the things in this bill are things that we've been working on for years. We've seen them before. Many of them have been introduced as standalone bills and have been reviewed at length by members of this committee. So it's not like this appears out of whole cloth. This is putting together a lot of good material that we have been working on for months and years now. I do appreciate the committee's willingness to incorporate some ideas that I and others have been supporting and pushing over the last few weeks and months, in particular those that relate to workforce investment and also moving more in the direction of primary and preventive care, which I think is going to make a tremendous difference to the system going forward. I think this is a good bill. I mean, we've heard a lot of people criticizing it, obviously from the other side, and they're trotting out all the arguments that you would expect. But fundamentally, this is a sound bill. It's a good bill, and it does the things that Americans have been crying for a long time now. It attacks waste in the system in a significant way, which is going to lead to reduced costs over time. It breaks the stranglehold that the private health insurance industry has had over the system for so many years. It does that in a number of ways, but I'll just point out a couple. One is no more discrimination based on pre-existing conditions. Just about every family in the country has some perspective on that struggle. And so that's a critical element of this bill. The other thing it does is it puts this public option into the mix, this public plan option into the mix to help create more competition. It's not about driving the private health insurance industry out of business. That's not going to happen. I spent 20 years working in healthcare, representing providers and dealing with these private health plans. They're going to be just fine. They're going to be just fine under this new system. All we're doing is saying, let's put some more options into the mix so we can give Americans more options. And as I said, it invests in the workforce and in primary care. A little bit earlier, I heard somebody on the other side say, if it ain't broke, don't fix it. Well, it's broke. And most Americans understand this. They've moved past the need for a public plan option for health care reform. They understand that we have to do this. And if we go back to our districts and we haven't made this change, they're going to be saying to us, the uninsured, the underinsured, and the insured that are paying 20% premiums every year, weren't you listening to us? So in closing, let me just say, at various times over the last few decades, we've tried to fix this system. We've come close, but special interests have stood in our way. Not this time. This time, we're going to keep our nerve. We're going to push through, and we're going to bring a good bill home for the American people. I yield back my time.
Thank you, Mr. Sarbanes. Mr. Murphy?
Thank you, Mr. Chairman. A few weeks ago, when he testified before this committee, the chairman of MedPAC had to say this, quote, "The healthcare delivery system we see today is not a true system. Care coordination is rare, specialist care is favored over primary care, quality care is often poor, and costs are high and increasing at an unsustainable rate." This is an unacceptable indictment of our healthcare system. But we have even more reasons for systemic change when we look at what's happening at home. In Connecticut, a new report shows that between now and the end of next year, 48,000 more people are going to lose their health care insurance. Why? Well, in part because just 2 weeks ago, our biggest insurer that covers 50% of people in Connecticut announced that it was going to increase rates on individuals by 32% this year. So it's time for all the people in this Congress who talk a lot about reducing costs to actually walk the walk and support the things in this bill they're going to get at cost. That's prevention, the public option, and delivery system reforms. Yesterday, CBO laid it out pretty clear for us. The public option is going to save almost $100 billion in costs to our system. Why? Because by injecting competition into the insurance system, something that nobody here should be scared of, we can give consumers more choices and lower costs. That's a real number from CBO. But equally important are what we have to do on the payment delivery system. And here we can be much more aggressive. We have a system now that rewards volume, and it puts providers in an unsustainable position. They have to gin up a ton of business to be able to be paid what they're worth, and they try to keep quality at the same time. We can do a lot more in this bill to take ideas like accountable care organizations, medical homes, and bundling of payments to try to correct that situation and let the federal government get out of the way of medical care and allow physicians to focus on what they want to do, which is be paid for quality. Mr. Chairman, 2 weeks ago, a man came to one of Congress on a Corner events that I hold every now and again at grocery stores, and he told me this story. A version of this can be repeated 1 million times around this country. He's worked his whole life in construction. He's got 3 kids, but he's out of work right now, a victim of this paralyzing recession. He's desperately seeking a new job, but he wakes up every day in debilitating fear. Why? Because he's got diabetes, and he can't afford right now to buy his medication. So he is waiting for the day that he ends up in the hospital and the medical bills mount so that his family loses their home and becomes one of the 50% of bankruptcies in this country that can be attributed to medical costs. That guy came to me with a question. He said, what is this whole health care debate going to do for me and my family? Well, Mr. Chairman, the bill before us, which gets 97% of Americans covered, lowers the cost of health care insurance for everybody. Well, it can be a better bill when we're done with it over the next few days, but I'm pretty confident it provides the start of a pretty good answer. And I yield back.
Thank you, Mr. Murphy. Mr. Space.
Thank you, Mr. Chairman. I am committed to passing health care reform that lowers costs and improves quality for all Americans. I sit here today ready to work with Chairman Waxman, Ranking Member Barton, and my colleagues on both sides of the aisle. Our goal is the same. The skyrocketing cost of health care is not only bankrupting American families and businesses, it's leading this country down a path to fiscal disaster. Our current system is riddled with inefficiencies and waste. Our misaligned incentives increase costs and fail to reward high-quality care. However, we cannot fix these problems simply by pouring more money into a broken system. Here is what we must do. Find every penny of savings within our current public programs and ensure we get more value for every health care dollar we spend. Be more aggressive in implementing innovative delivery reforms to bend the cost curve and provide assistance for individuals, families, and small businesses to help them purchase health care without bankrupting the federal government. Over the past several months, Blue Dogs have put forth substantive policies in order to achieve common sense and bipartisan health care reform. We look forward to working through the markup to incorporate them. We have an historic opportunity to transform our health care system into one that meets the needs of all Americans. We cannot pass up this moment without fundamentally changing the incentives in our system to reward high-quality, efficient health care. I yield back.
Thank you very much, Mr. Space. Ms. Sutton.
Thank you, Mr. Chairman. We're all familiar with the numbers, millions of uninsured, millions of underinsured, Americans across the country falling into bankruptcy due to medical debt. These numbers cry out for reform. But, Mr. Chairman, the fear tactics are in full swing. Those who've been profiting so long under our current system are piling it on. The Washington Post reported that the healthcare industry is spending $1.4 million a day in this fight. But the American people are smart, and by 70%, they support a public option to compete with private insurance to improve our system. As a state representative in Ohio, I work to try to stop insurance companies from unreasonably delaying or denying care that people had paid for. And during that work, I came to know a bright young woman by the name of Linda. And Linda worked in HR at an insurance company. And she had a family history of a very aggressive type of breast cancer. So when Linda was stricken, her doctor wanted to treat her aggressively, but the insurance company overruled her doctor and denied her coverage for the care that the doctor said she needed. So Linda and her family tried hard to raise the money, and after months of delay, eventually she had the procedure. We can calculate the financial cost to the family for the denial of care Linda experienced at the hands of the insurer, but we will never know how much the delay cost Linda by way of her health. Linda died the following year, but she kept fighting until the end to ensure that others with insurance would not be denied by an insurance administrator the care that their doctor determined was needed. At Linda's funeral, her young daughter read an essay that she had written about how her mom was her hero. Because not only did she fight against her disease, but she also fought her insurance company and fought to make sure that others would receive the care that they need when they need it. Shortly before her death, Linda sent me an email that I have kept ever since. She apologized that because of her illness, she could no longer come out in public to continue the fight. Can you imagine? She was dying, and she apologized because she was not physically able to come out and fight to make our system work. Well, I'm here to fight to make our system work. By injecting competition into a system that has left millions uninsured, millions underinsured, and has allowed unreasonable delays and denials of claims to persist, doctors will once again be able to treat patients. Mr. Chairman, people need access to affordable quality coverage and care. It's not just they who will benefit, but as a whole, we will all benefit. As healthcare costs continue to rise year after year, families, doctors, hospitals, and businesses are all struggling to pay the rising costs. The details of what we come out with matter, and I look forward to a good product. And I hope, Mr. Chairman, when we are done, there will never be a reason for a child to ever again write and read an essay at her mother's funeral about how her mom was her hero because she fought her disease and her insurance company at the same time. And I yield back.
Thank you, Ms. Sutton. Mr. Braley.
Thank you, Mr. Chairman. I'd like to ask unanimous consent to submit my full written statement for the record.
Sorry, what did you say, Mr. Braley?
I'd like to ask unanimous consent to submit my full written statement for the
Without
record.
objection.
I want to thank you and Chairman Pallone, Chairman Emeritus Dingell, and the committee staff for the extraordinary work you've been doing on a very difficult and very complex bill. I ran for Congress in 2006 primarily because I felt we needed to fix a broken healthcare delivery system. And I'm very excited about some of the steps, the important steps this bill takes in trying to meet the needs of that broken system. We have a once-in-a-lifetime opportunity to make significant changes to our current wasteful system that leaves millions of American families with no healthcare safety net, millions more with health insurance that's unaffordable, and yet still continues to provide wasteful overutilization that costs the American taxpayers billions of dollars. We need to seize this opportunity and bring about meaningful health care reform. And one of the reasons why I have been so passionate about making this happen is because of what we know about the problems in our current health care delivery system. This chart, which was prepared by the Commonwealth Fund, shows the problem with our current Medicare funding system. You have states that consistently rank in the top 10% of all states in quality outcomes according to analysis of Medicare's quality improvement data. And yet those same states rank in the very bottom 10% in terms of Medicare reimbursements. While you have a state like Louisiana, which costs us more per Medicare patient than any other state, over $8,000 per patient, and ranks 50th in terms of quality outcomes. That is a broken system, and it needs to be fixed now. All medical economists agree that we have billions of dollars of waste due to geographic disparities and overutilization. And that's why I'm specifically concerned about Section 223 and 224. Because this is where the greatest opportunity to capture cost savings and promote quality care outcomes and improve patient safety exists. Modernize payment initiatives and delivery system reforms. And yet we've put together an Institute of Medicine study that will perpetuate current geographic inequities by preventing those providers who provide the most wasteful care from having any consequence for their action. And Mr. Chairman, one of the things that we've talked about is having the Institute of Medicine study this problem. Well, in 2003, Congress passed the Medicare Improvement and Modernization Act, mandating the Institute of Medicine to study this problem, propose recommendations. They did that in 3 reports, and those reports contain recommendations to Congress and the Secretary of Health and Human Services to address this problem. We can build on those recommendations. We can incorporate them in this bill and have a much better outcome, and that's what I'm aiming for, and I thank you for your hard work on this problem.
Thank you very much, Mr. Braley. Now, the gentleman from Vermont.
Thank you, Mr. Chairman. This is a very long bill that has one simple goal, and it is access to affordable health care for every single American. And it embraces the proposition that every American should have access to health care, that every American has the personal responsibility to help pay for health care, and that no American should lose his or her health care if they lose their job. And it works towards that goal in 3 different ways. First, insurance reform. And with all the discussion about the public plan, which would have to compete on a level playing field with private insurance, the major reforms are in the insurance market. All insurance companies that are going to provide and sell health care to our citizens are going to have to play fair. They're going to have to provide a level of benefits, preventive care without huge out-of-pocket expenses that drive people away from the doctor when they need to go, drive them into bankruptcy when they shouldn't be there. It will prohibit insurance company from denying you coverage because of a pre-existing condition. It will guarantee that you can continue with your insurance even if you get sick. These reforms are overdue and extremely necessary. They're potent, and they will be effective. Secondly, this bill begins the process of imposing cost control, bringing about cost control into the delivery system. We cannot have a health care system for Americans that rises in expense 2 times, 3 times the rate of inflation, the rate of profit, the rate of wages. And no matter how we pay for a health care system with costs that are unconstrained, it will bankrupt itself. And what we are doing, and Mr. Chairman, I thank you for assisting all of us here on including in this legislation reforms like accountable care organizations, medical homes, and other steps that are essential to change the payment system and reward value rather than volume. We are beginning in this bill to make a major reform in how we deliver care so we can get better outcomes at lower price. And then third, this bill makes good on a promise and a goal of all Americans, Republicans and Democrats, and that is that everyone have access to health care. Fully 37 million of the 47 million Americans who now have no coverage will have insurance. They'll be able to see a doctor of their choice. Many of my Republican friends have decided they're not going to vote for this bill. But my request to them, make your decision, but help us make a better bill. If you have good amendments, this committee will entertain them, and we can make the best bill for the American people that we ultimately get that chance to vote yes or no on. When the number one reason for personal bankruptcies in this country is health care debt, it's time for reform. When good American jobs are being shipped overseas because the spiraling cost of health care cripples our competitiveness, it's clearly time for reform. And when the first gift that a graduate from college receives is to join the ranks of the uninsured, it's time for reform. Thank you, Mr. Chairman. I yield back my time.
Thank you very much, Mr. Welch. I believe all members have had an opportunity to give an opening statement that wish to. The record, of course, will allow members to submit statements, and they will be a part of the record. The Chair would like to now call up H.R. 3200 and have the clerk report the title of the bill.
H.R. 3200, a bill to provide affordable, quality health care for all Americans and reduce the growth in health care spending and for other purposes.
Without objection, the first reading of the bill will be dispensed with. If what do I do next? H.R. 3200 is now considered as read, and the clerk will designate Section 1.
Section 1, short title, table of divisions, titles, and subtitles.
Chair now recognizes himself to offer a manager's amendment to H.R. 3200 in the form of an amendment in the nature of a substitute. The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 3200 offered by Mr. Waxman of California.
And,
strike all after the enacting clause and insert
without
the
objection,
following.
Chairman, reserving the right to.
Well, let me put the unanimous consent request in. The gentleman, I'll recognize you on the reservation. Without objection, the amendment in the nature of a substitute will be considered as read. Gentleman from Texas, Mr. Barton, on his reservation.
Okay, I want to make sure. Where am I in my reservation, Mr.
Well,
Chairman?
I ask that it be considered as read, and you reserved a right to object.
So I have reserved that right.
Yes.
Okay, I wanted to reserve that right.
Yeah.
Okay, I'm trying to be nice. This is my nice day, Mr. Chairman, and so I want to commend you on my reservation for the opening statements. I know every member of the Republican side made an opening statement, and from what I could tell, most members of the majority also made an opening statement. I think that shows how serious this issue is. My reservation, Mr. Chairman, is on the alacrity with which we're going to consider this piece of legislation. Again, to give you a pat on the back, our committee is going to take more time than the other two committees of jurisdiction combined, so that's a good thing. But having said that, the manager's amendment in the nature of a substitute, I believe, is the binder. And I believe we got that sometime this morning. There is no way any member or any staff member or any
group of staff members has had time to read that today.
Gentleman yield, it was circulated last night, but I take your point as valid. Members are still reading it.
So here,
Mr. Boyer took it to bed with him and still, just
I know that
hadn't finished it.
That may say something. Well, I'm not going to say that. Yeah, I'm not going to. You're correcting me, Mr. Chairman, just in time. But here's my point. I'm not going to object to this because I know that there is tremendous pressure to move this bill, or at least to consider the bill. But on my reservation, I would ask you to comment on, as we get into the substantive part of the markup. We've got A, B, and C. We've got Division A, Division B, and Division C. We're going to start on Division A. I think start on Division C tomorrow, is what you said. Yes. As the markup progresses, if we see that it is not going to be an open and shut, all the Democrats vote one way, all the Republicans vote the other way, and I have listening to the opening statements, I got the impression that there are lots of concerns on the majority side as well as the minority side. So if we actually have real bipartisanship break out, which is a possibility, I'm not saying it's a probability, but it's a possibility, are you willing to go to your leadership and ask that the markup take a little bit longer than you've publicly said so we can actually improve the bill?
I am looking forward to bipartisanship, and I haven't seen the Republican amendments, but I've heard some described to me privately, and some of them sound quite reasonable, but I haven't read them in detail. I'm open to discussing changes on a bipartisan basis, but I'm not going to speculate as to not finishing this bill within the time allotted for us. But I'm always open to further discussions. I'm not asking you to give me an open-ended commitment, Mr. Chairman, because I know the pressure that you're under. But I think there is a reasonable possibility that we can actually have a markup that is a markup. And that would be a good thing for the public. It'll be a good thing for the country. And what I don't want to happen is next Wednesday night about 10 o'clock or 9 o'clock, if several amendments that substantively change the bill have been adopted, and of which there's still amendments to be considered that we couldn't go through Thursday or Friday or something like that. What I'm asking for is some possibility that we might have enough time next week. I think we're going to be here through Friday, that we could continue past Wednesday evening. Now, you have the right to move the previous question at any time, and if I don't object right now, you only have to do that one time, because if we accept the manager's amendment in the nature of a substitute as the vehicle, then then there's only, we don't have you can move the previous question one time and shut the markup down. I hate to ever say that I wouldn't consider anything that's reasonable, but I do want to point out that we've been delayed. We wanted to meet late tomorrow night, and I think it was at your request that we are leaving early. We wanted to meet earlier on Monday, and other members requested that we come in later. I would like us to just concentrate on this bill and move forward with it. Let's see how that goes, but I'm always open to good ideas.
This is the most important. This and the climate change bill are the two most important bills this committee has considered in a number of years. I think you'd agree with that. And yes. The health care bill, to some extent, is even more important than the climate change bill, because the health care bill so immediately impacts everybody in this country. The climate change bill is a little bit more amorphous in that, 30 years from now or 40 years from now, what's the CO2 concentration in the upper troposphere? That may not be of immediate concern, but whether somebody has health care insurance or health care access next year or 2 years from now is of immediate concern. And I think we are the premier committee of health care jurisdiction.
If the gentleman would permit,
be happy to
I don't disagree with you at all. This is a very important bill. And I want to see what changes you have. And if you have something that's very promising, I'll tell you, I'll stay here all weekend and work with you on it. And we'll be in better shape next week to move forward in the direction you think that might lead us to a bipartisan bill. I would never close the door on that if there's a promising opportunity. But I'd like to not ask you to pin me down any more than that. Because we really have the
I understand. Well, Mr. Chairman, I'm going to withdraw my reservation. I think you understand my point. The importance of this bill and the need for transparency, and the process argument is a difficult argument for people to understand. But in this case, I think most Americans will follow the debate in this committee, and to the extent that we engage in an open, transparent process that gives all of the substantive amendments an opportunity to be heard and voted on, the work product and the credibility of this committee and the Congress will be better for it.
I strongly agree with the gentleman. Now, if there's no objection, the reading of the amendment will be dispensed with. And without objection, amendments drafted to H.R. 3200 are considered to conform with this amendment in the nature of a substitute. Without objection, that'll be the order. Without objection, further, we'll stand in recess until 10 a.m. to tomorrow morning. Thank you. That concludes our meeting for today.